live streaming now.
Thank you, everyone, and welcome to our council meeting for Wednesday, May the 27th, an electronic meeting, as we know. Public notice, due to the efforts that contain the spread of COVID-19 to protect all individuals. As you're aware, city facilities are not being open to the public or attending to council meetings or committee meetings until further notice. The public may submit comments regarding agenda matters via email to clerks@richmondhill.ca. Comments will be provided to all members of council, considered as public information and noted as in the public record. Electronic delegations. The public may appear as on an electronic delegation by video conference or by telephone. Applications to appear must be submitted by 12 noon the day before the meeting by email to clerks@richmondhill or by an online application form found in richmondhill.ca. So at this point in time, we shall call the meeting to order and recite the national anthem, and we'll ask us all rise, please. Thank you. All right, council announcements. Members of council, an announcement. I'm looking up at people at this point in time. I'm not seeing anybody that has an announcement. Is next then is introduction of any emergency time-sensitive matters. Once again, I'm not seeing any members of council. So we have a point to the agenda. The agenda today is we've got, what do we have? 13 items, 3 presentations, 2 delegations, a number of others, 6 bylaws, etc. And there's 2 or 3 items that have a delegation. So with that, can I have a motion to adopt the agenda? Seeing hands, Councillor Chan, Councillor Crowley. I'm just looking at people moving. All those in favor of the agenda? Opposed? That carries. Thank you. Is there any disclosure of pecuniary interest, the general nature thereof, of any members of council? Seeing everyone. No, Mr. Clerk, there's no one there. disclosures. And the adoption of previous council minutes. There have been 3 council meetings. C-1620 held on the 13th. 1620 held a special council on the 13th. And an emergency council on the 14th. Could I have a mover and a seconder of all 3 of those minutes, please? Councilor Barros. I have another Councilor DiPaolo. Thank you. All those in favor? Opposed? Thank you. Okay, we now have.
Paused on live stream.
I'm sorry.
You said it's good. Oh, hi.
Okay, no, I just heard a voice. That was all. I didn't know. All right, we have, as I said, 2 delegations, 3 presentations. Is there any other items that require separate discussion on the list of that we have? Is there any other items that are on the agenda that people wish to discuss? Seeing none. I'm looking at everybody. They're all on one page now. Thank you. All right. So can I have a motion for adoption of the remainder agenda items, please? Councilor Pirelli and Councilor Silivitz. Any comments at all? Clearly not. All those in favor? Vote. Thank you. Public hearings, we do not have any at this time. All right. Our first presentation, and make sure we found them here in the play, is a presentation by Altaf Stationwala, Mackenzie Health President and CEO, regarding an update and enhanced patient care at Mackenzie Health Richmond Hill Hospital and a construction update on the new Mackenzie Vaughan Hospital. Mr. Stationwala, welcome.
So, Your Worship, Mayor Barrow, thank you, and members of council. It's a pleasure to be here. I do this every year. In past years, it was in person, but I do appreciate you accommodating me via this virtual update. So my objective over the next 10 minutes or so is to give you a little bit of what's going on in the healthcare environment. As you can imagine, as you are dealing with COVID, so are we very much in the front lines. And before I get into the content, I just want to thank council and all the residents for your incredible support over the last number of months. Your words of support to our frontline staff, all of the images that are on Trent Street supporting our frontline staff as they sort of face very, very challenging day-to-day sort of situations in the hospital. It does not go unnoticed. Councilor DiPaolo, you came by and donated some PPE. Mayor Barrow, I saw you in the honkathon on that Saturday. And many of you have also continued to support us in so many ways. Again, we really do appreciate Councilor Pirelli, the offer of food for our staff as well, I remember. So again, thank you. And I'll give you a little bit of what's going on. So obviously for us, COVID-19 has introduced another burden of illness and capacity pressure for a very challenged hospital. As you know, the Richmond Hill site has always been challenged in terms of pressures, and we've always been in a situation where we're over occupancy. Now you add COVID to that, it makes it that much more challenging. So I'll give you a little bit of that along with sort of what's going on with respect to the Vaughan Hospital. So the slide that you have in front of you really starts to describe the efforts and really our focus of keeping staff and patients safe. You can imagine that when we first embarked upon this, and we were aware as late as December of an unfolding situation in China, and as early as January, we started to get ready for it. We didn't know what it was. We thought it was some form of pneumonia, but as we started to get more information, as the province got more information, we started to get ready. So as early as January, we actually started doing inspections of all of our air handling units for our negative pressure rooms. We started to stockpile PPE. We started to go through all of our policies and procedures with our staff to ensure that they knew, no, we'll stay on that side, sorry. Please go back to Thank you. That they knew what to do in case something did transpire. At the same time, we continue to focus on the Vaughan Hospital, knowing that adding capacity is much needed in this region, and it would only further help in the COVID response. The technology agenda that we have, I'll speak to it, but it continues to be a focus. And for us, obviously, securing funding, in particular for the second site and our capital campaign, is still a focus. You'll see throughout this presentation that the investments that we continue to make, as much as we're focused on Vaughan, a lot of what happens in the Richmond Hill site first, especially on the technology agenda. We'll go to the next slide, please. So for us, obviously, the effort around the COVID response really did start to shift in the month of February. What we saw very quickly was a need, and obviously directed by the province through orders, a need to fundamentally change how we operate the hospital. So what occurred at Mackenzie Richmond Hill Hospital occurred at hospitals across the province. So the first thing was to contain the hospital. And as challenging as it was, we started to restrict access for visitors and certain patients for ambulatory procedures, only to contain the environment and to ensure that, that we had sufficient PPE, because obviously every visitor and patient that came into the hospital required PPE, but just also to ensure that we were keeping people that didn't need to be in the hospital sort of outside. What we did facilitate through all this, and obviously it's challenging not having loved ones around patients, we've actually done over 4,000 virtual calls between families and patients on our iPad technology. So that does ensure that family members can be connected. It's a very challenging time for family members, and we ensure that they're always in the loop as to what's going on with their family member. Another thing that we had to do very, very quickly, and all hospitals have done this, is create a COVID-19 assessment center. Now, as you can imagine, real estate isn't flush at the Richmond Hill site, but what we did do is we converted our day surgery recovery area into an assessment center. We are by far the busiest assessment center in New York region. And with the additional announcements by the Premier over the weekend, we are now regularly seeing over 200 we do over 200 tests a day. So obviously an important component for surveillance and ensuring that we have an understanding of what is going on. The hot spots for us in our catchment area, Richmond Hill is actually quite stable. Vaughan is the current hotspot, and that's where we're seeing most of our positive tests occur. To ensure that the system had adequate capacity, we were given a Directive 2, which was an order requiring all hospitals to stop non-essential services. So we started and did suspend all elective and scheduled procedures. And obviously that was to create capacity. So at the peak of creating capacity, we actually had almost 40% of our beds empty. And that was really by restricting elective procedures. But another phenomena happened, and it wasn't a good one, and that is that people stopped coming to the hospital for critical care. So our MERS that would see on average 350 patients a day started seeing about 150 a day. And over the weeks, what we then started to notice is patients coming in way too late. So we actually started to see significant mortality and morbidity by patients waiting 2-3 days after having chest pain, or patients no longer coming for their outpatient dialysis visits. We continue to encourage the public, and you would have seen that in my regular updates to you as council members, encouraging members of the public to continue to use the hospital. It was a safe place to receive emergency care. And fortunately now we're back at about 250 visits a day in our MERG. So people are again back at using the hospital. We had to create a whole host of different inpatient environments. So we converted one of our surgical units to a dedicated COVID inpatient unit. We converted our day surgery space to an additional 15-bed ICU unit, securing supplies wherever we could, securing additional ventilators from the provincial stockpile. We had to be ready. We had to ensure, as we saw in New York and in Italy, that the pivot point was all about access to critical care. And again, fortunately, we actually never had to activate those spaces, but we were absolutely ready. And at the same time, we had to start to support, and this was probably in the last month, support components of the system that were really failing. And you've seen the media headlines around long-term care, around retirement homes, and congregate settings. So we created a 7-day-a-week hotline number to support upwards of 30 different locations in the region, from retirement homes to congregate settings to long-term care facilities. We became the focal point for the region. So even today, we're supporting 18 locations from IPAC support. So this is supporting them with our infection practitioners and our infectious disease physicians, supporting them with additional staff where they've not been able to secure adequate staffing, and doing swabbing in all their environments. So we've swabbed over 3,000 of their residents and their staff members to support them, obviously, at this time. We also created a COVID-19 response fund, again, thanking all of you and community members for your donations and supplies, but also some of the monetary donations as well. Next slide, please. So what we know, and again, we thank Council for all of your public messages around requesting residents to stay safe, for all the measures you took to align with the emergency measures and start to contain environments. The social distancing absolutely worked. We did bend the curve. We did not see the spike in hospital activity. And that was, a measure by all of our local leaders, reinforcing the messages to stay safe. What we have seen, nonetheless, is the hotspot of COVID activity being the GTA. You've probably heard today that almost 80% of the provincial COVID activity is in the GTA. And York Region got hit early. So because of some of the travel-related components of COVID activity, in particular travel from Italy, travel from China, and obviously travel from the US, we did get hit early. And, our world changed dramatically well before anything happened. So you would have read all of this in the media. End of February 28th, we saw 3 presumptive cases present in our emerge department. And this was not related to travel advisory that had yet been made public. This was related to Egypt. And this was all related to a group of residents that had traveled to Egypt. And you can see an image of Linda Lamb there. So Linda Lamb came in early on, was stable, was recovering at home, and then became quite sick. And was very quickly, by the first week of March, admitted to our ICU, and was not in a very stable place. We were thinking the worst possible scenario for Mrs. Lamb. And imagine that really nothing had happened in the province. So the provincial emergency was not to be declared for another 2 weeks. The NBA season, the NHL season was going on. Yet our staff were in the midst of a real crisis where we were actually dealing with a very, very sick patient. They were afraid, and we continued to support them with PPE and all the things that we practice. So it's one thing to practice it. It's another thing to actually have to deal with it, having our environmental staff go in the room and clean the space, having our nursing staff, our RTs, our physicians. I can tell you that the story of Mrs. Lamb is incredible. Our physicians very quickly went to the federal government, asked for an exemption for a trial drug, a drug that had only been used for Ebola patients. And this drug actually, we believe, had an outcome effect on Mrs. Lamb's recovery. So I can tell you that about 3 weeks ago, she was discharged from the ICU, and about 10 days ago, she was discharged from the hospital and has made a full recovery. So this is just an amazing story of what our local hospital did and kind of playing in the big leagues with experimental drugs. We are now sort of working around planning to a new normal. And the new normal is a bit of a challenge. So as you know, we have deferred a whole host of scheduled procedures. Some would say that the backlog in surgery will take us almost 2 years to catch up on. And these are not trivial procedures. These are cancer surgeries. These are important procedures around orthopedics. These are procedures around urological cases. And we continue to prioritize the sort of life and limb cases. So where we would normally be running 8 or 9 ORs, we're running about 3 right now. And we are looking at ramping up that. And that was really linked to a directive 2 that was issued by the province. That Directive 2 was lifted yesterday, giving us the authority to start to plan doing more procedures. Now, the procedures have to sort of be predicated on meeting a bunch of thresholds, i.e. having enough PPE, having enough drug, having enough staff, having enough ICU beds. I can tell you today that even without ramping up, we're already at 90% capacity. So this will be a challenge, but we will work with our surrounding hospitals to start to deal with the backlog. And obviously for us, the addition of the second site will be a sort of a huge additional bolus of capacity that enables us to start to deal with that. Next slide, please. So just by the numbers, and just to give you a flavor of just how busy we are, and we don't publicize this, you know, we have purposefully, and I've been criticized by some of not publicizing more of what we're doing. We made the conscious effort of obviously getting some publicity where it made sense. You know, I get called by the media every day for some kind of story. Our efforts have been ensuring that our staff are well communicated within. So our comms team is focused on informing you, our key stakeholders who can inform the public, informing our staff, and where appropriate, you know, engaging the media. Why? Because we are absolutely so busy with COVID activity. So well over 8,400 tests that we've done. You know, these numbers are as of May 22nd. I can tell you that they've gone up since then. So since then, we no longer have treated 31 patients. It's now 34 patients in our ICU, and now over 135 in our general internal medicine beds. So we are at this point the third busiest COVID hospital in the province. Markham and Southlake have declined dramatically. I'm not sure why we are as busy, but again, we believe some of it's linked to the Vaughan burden of disease that exists, in particular in Maple and in Kleinburg. We have even done amazing things. We've had a baby born to a COVID positive mother who's doing very well, as is the baby. We actually had 16 moms that were suspect COVID that we delivered in these new protocols and practices, all with great outcomes. So you should be incredibly proud of our frontline staff and our leadership. They've done just some amazing things. Next slide, please. So, you know, what worries me going forward, and you would have seen some of these articles, the CBC did an expose on overcapacity in the month of January for hospitals. And obviously for us, out of the 169 acute care hospitals that they looked at, the Richmond Hill site was by far the most overcapacity hospital in the province. They looked at 181 days. Of those 181 days, we were over capacity for 179. So we were by far the worst. We were profiled quite extensively on that. And, you know, we were caring for, on average, about 380 to 400 patients in our ED every day. We actually hit certain days of over 500, which is the busiest ED in the province. We have the third largest number of ambulances coming to the hospital in the province, about 470 to 500 EMS visits per week, and that's about 70 a day. Now, that's not the situation today because either people are staying away from hospitals or we've deferred certain care, but that is returning. And for us, along with COVID, which is not going away anytime soon, we really have to start to look at capacity. So we are obviously in a very positive place because the addition of the second hospital will absolutely help us. But we continue to plan for surge. We have a whole bunch of community programs like McKinsey Helps that helps us move patients out of the hospital, but it is obviously an ongoing challenge. Next slide, please. So I've shared this slide before. This starts to give you a flavor of the capacity that both hospitals will create. The Richmond Hill site at about 515 beds, and Vaughan opening with 350, able to go to 550 beds. And when we look at the issues in the GTA, you know, the problem spots are really in York region and Peel region. And when we look at the location of Vaughan, it will support some of the other overburdened hospitals like Southlake, like William Osler. Obviously we are getting huge support from the province to open this hospital to full capacity, to be a huge benefit to the entire region, but obviously a huge pressure valve release, obviously, to the Richmond Hill site as well. The diagram shows the distribution of services. Obviously, both are full service hospitals with critical care, emerge, all the diagnostics, operating rooms. but there will be a distribution of specialty services between the two sites, complex care and inpatient rehab beds being at the Richmond Hill site, along with most of the ambulatory clinics and our CKD, our regional program. OB, PEDS, stroke, and mental health will be located at the Vaughan site. But obviously, that can obviously be one door to enter, and will obviously direct people to the best and most appropriate program. And you can see that both hospitals are surrounded by a whole host of outpatient locations that we have across the region, from Richmond Hill to Oak Ridges to Barrie to Vaughan, and those locations will continue to operate even with the addition of the second site. Next slide, please. So just some images of the construction. We are very much nearing the completion of the build, and incredibly excited. When you drive by, see how powerful the image of that site is. We had some challenges last summer. We had a provincial strike of sheet metal workers that created a delay of about a month to our project. And obviously the pandemic has had an impact as well. So there was a point in early March where a bulk of the laborers walked off the site because they were afraid for their safety. We worked with PCL. We actually brought in our IPAC team to support them, to bring in different protocols and practices, show them how to mask their staff. And then the fact that the province declared Mackenzie Vaughan Hospital as an essential construction site also helped us, because we can now operate 24 hours a day, which enabled the social distancing where trades could work, over the midnight shift, so that they were not sort of stepping over each other. So at this point, we don't feel there's a material impact. We are still looking to have the building delivered to us from PCL end of August, and are hoping to open in early 2021. So that's great news, because as you know, we needed this hospital opened probably about 3 years ago. Next slide, please. So we continue to excel on multiple levels. And again, all these investments occur at the Richmond Hill site first. So as you know, and I've shared this before, we were the first acute care hospital in Canada to achieve this electronic medical record adoption. So which it was basically means that we're completely digital with the Epic software. Just this year, unfortunately, we were not able to receive that award in February because of COVID, but we also achieved the Davies Award. And the Davies Award does not look at the adoption of the record, but it looks at the clinical outcomes and how you improve care. So again, we are only the second hospital in Canada to receive this. I'm very proud of that, because it demonstrates how we made improvements in stroke care, in our CKD program, and in our cardiac program. So very, very proud of that. We now have 2 modular data centers. We've had the one up and running in Richmond Hill for the last 3 years. It's now connected with a dedicated fiber optic cable between the 2 data centers, so they now back each other up. So if our data center goes down in Richmond Hill, Vaughan backs it up, and if Vaughan goes down, Richmond Hill backs it up. So complete redundancy. We are piloting a MyCare application, so that will be a bedside terminal for our patients, so that they can get all their patient education right at their bedside. They can communicate with their nursing staff. They can obviously see entertainment information, and they can actually talk with their loved ones. So that is being piloted at the Richmond Hill site, and obviously deployed in Vaughan as well. And then the MyChart portal that many of you are aware of continues to be added with more and more features. So even today in the COVID environment, people are able to do all kinds of things like book their assessment center visits online. So again, a very powerful tool, all sort of enacted at the Richmond Hill site today. Next slide, please. So as you know, we have a very significant community campaign on, and we're doing very, very well. We're at 177 million against a $250 million target. There's no 2 ways about it that COVID did affect some gifts that we were hoping to close over the last couple of months, but we're hopeful that the community will continue to support both hospitals and understand that more than ever, we need a solid foundation of healthcare and hospitals. So we are actively working on that campaign. Next slide, please. So as council, you should feel incredibly proud of the local businesses that play not just locally in supporting Mackenzie Health in our technology adoption, but these are companies that have a national and international profile, like CompuGen, like Amico, that's actually just around the corner from the council offices, like Flexity as well, and Philips, that I would argue is just on the other side of the 404, but is, in my view, still a Richmond Hill company. And we obviously have a very significant investment with them. So local jobs, local economy that's being supported, and very significant companies that have a footprint in Mackenzie Health, but also obviously a footprint internationally. So Amico provides all of the booms and all of the technologies that go in our ICUs and in our operating rooms. Compugen is actually the company that's helping create this smart hospital and all the digital technology that we have in play. Philips is providing all of the large equipment and technology in our imaging areas and in our diagnostics. And Flexini is actually the company that's supporting the MyCare solution, along with some of our other servers and technology. So again, very proud of these companies. They've been great partners, and we're fortunate to have them locally. And that is the end of my presentation. Happy to answer any questions. But again, before I end, thank you for all the support from council. Thank you for all your leadership in ensuring that our residents understand that their efforts of social distancing has enabled us to battle, I would say, the most challenging thing I've ever faced in my career, which is COVID-19. So thank you.
Thank you, Mr. Station Wallow. That was incredible, actually, and an update on enhanced and incredible work that's being done. I'm looking for you now in the process, and by a hospital, and of course, once again, the frontline staff that make it happen. So I'm going to ask if, yes, please, rather than everybody waving, I want to take down names so that I'm not looking for anybody. So I can see Councillor Silovitz, Councillor West. I just want to make sure that we don't end up running around here. Any other people? Councillor Chan, thank you.
Thank you, Mr. Mayor, and thank you.
Just one second. Mr. Councillor Chan, you're the third speaker. You're the third speaker, okay, sir?
Yes, thank you. Thank you.
Oh, you're not speaking at this time. I'm trying to explain to you. I'm trying to take a list of people who wish to speak, and then I'm going to put them out in that order, just so I don't have, exactly this doesn't happen, if you don't mind. So the first person that has to speak is Councillor Silovitz, please. And then we'll come to everybody.
Thank you. Thank you, Mr. Mayor. If you don't mind, I'll defer to Councillor West first. Is Mackenzie Health is in his ward. I can speak second. Thank you.
Thank you. Thank you, Mr. Mayor. So I just wanted to take this opportunity, Mr. Stationwall, to thank you for all that you do, but also, and as you've said many times in your presentation, to thank all of the other folks that are working in the hospital for all that they are doing. It's, you know, the hospital is always a very important part of our community. That's pretty obvious. But it is blatantly obvious in this time. And I mean, I think that the way that the hospital has operated and the decisions that were made proactively in the lead up to this pandemic have served us very, very well. And, you know, as a member of the President's Advisory Committee, I did know a lot of the details or the general themes that you talked about in your presentation already. But I also know how incredibly difficult it is to juggle all the balls that Mackenzie Health always is seeming to juggle. And, you know, my hat's off to all of you. And on behalf of all of the residents in Richmond Hill, I want to, you know, offer our more than usual sincere thank you for all that you do. It truly is amazing, the work that's being done, and you are really an inspiration to our community. So thank you. We're not out of the woods yet, and I'm sure everyone knows that. So we will continue to do what we need to do. And I'm confident, you know, that with your leadership and the rest of the leaders in that hospital and all of the staff that work on the floor day in and day out and do heroic work will be served well. So thank you, and stay safe.
Thank you, Councillor West.
Thank you, Councillor Silovitz.
Thank you. Thank you, Mr. Mayor. Thank you so much, Altaf, for your presentation. On behalf of all residents, especially in Ward 5, I want to thank you and all the staff at Mackenzie Health, Richmond Hill. What you do is central to helping us, assisting us, protecting us as the residents in Richmond Hill and beyond. So thank you. Everything you do is quite remarkable. I can only imagine how how much you're all have been run off your feet. You must be absolutely exhausted. But day in, day out, 24 hours a day, Mackenzie Health continues to serve our region. So thank you so much for everything that you do. Through you, Mr. Mayor, I'd just like to ask Altaf just a couple of questions. With regards to the assessment center and the latest news coming out of the province that we're not meeting our assessment targets, can anybody come to the hospital to be tested? For instance, if I wanted to come, I'm not symptomatic, but I would like to be assessed to add to those numbers and make sure that we are reaching our targets. Is it possible for me to just come to the hospital, or do you still have to call ahead and have an appointment? I want to try and embrace this for all our residents in Richmond Hill, and let's help push up those numbers, the provincial numbers, and help us meet the assessment targets that are so necessary as we move through all these protocols.
So a great question, Councillor Sullivan. So our assessment center is open from 11 a.m. to 11 p.m. on weekdays, and I think from noon till 8 on weekends. Our rate limiting step has never been an absolute number. So, we do about 140 a day. Without any issue, we did 240 yesterday. So we encourage people to make appointments, because that way you're in and you're out within 5 minutes, and you're not creating other issues. And what we noticed is when we did walk-ins, people actually didn't practice social distancing. So they created another risk because they were congregating and creating a line. And as much as we tried to keep them separate in the line, they didn't necessarily observe that. So again, we encourage you to make an appointment. It's usually accommodated same day. You can do it off our website. There's also, if you're on my chart, you can do it virtually. If you want to call in, there's a number there. We will take walk-ins as well. So there is the ability to do that. But again, our direction is to use a scheduled approach. Now, just some science that we should obviously understand. So if you're asymptomatic and you're being tested, your viral load is not really there. So even if you are COVID positive and you may be in the first couple of days of the disease, it's very hard to get enough viral load on the swab. So you may actually become a false positive, a false negative. So, again, we encourage as many people to get tested, but then the issue is if you feel greater symptoms come on, we encourage you to get tested again, because the strongest way to measure is that if you're actually symptomatic. But we also know that we could be doing more testing. So again, encourage your residents to be tested. Now, there were challenges in the early months of this response. So the first challenge was the labs just didn't have enough capacity. So doing more swabs didn't make sense. There was also a challenge where we actually ran out of swabs. Ironically, the company that makes these swabs is located in northern Italy, which got hit the hardest, in the early parts of February and March. But we now have ample swabs. We have testing capacity. So, we're in a position to do way more testing. And the criteria that were directed, and I know some were feeling quite upset that they would come to the COVID assessment center and then be denied a test. We were following the direction of the provincial medical officer of health, who gave us the criteria. So now the criteria, there are no criteria. Anybody that comes in will be swabbed.
Okay, thank you so much, Altaf. I felt it was really necessary to get that into the public purview. So all the information is on
your residents to go on our website again. Yeah.
So yes, so it's all on the website. If they go to the website, they know exactly the process and procedure they have to go through in order to go and get tested. And if I may ask also through you, Mr. Mayor, to Altaf, is the test that is done the nose swab or a cheek swab?
So it is a nose swab, and if you haven't had it, I'm not saying it's painful, but it's uncomfortable. They really shove it up your nose. So yeah.
Yeah. Okay. Yeah. They tickle the brain. Okay. Thank you very much. Just a couple more questions. with regard, through you, Mr. Mayor, to Altaf, with regards to long-term care sites, I know that we have one long-term care site at Mackenzie Health. And I know that from the daily updates that we get through Mayor Barrow sent to us from Dr. Kurji, there have been many, I would say mostly the vast majority of the deaths that have occurred in Richmond Hill and York region are the elderly and those who are in long-term care. So with that in mind, the facility at Mackenzie Health, how have you managed to manage that facility and ensure the health of all patients there?
Yeah, so, the challenge, and outbreaks are not uncommon, and you are aware probably all hospitals have been in outbreak mode. So we've been in outbreak situations. An outbreak is a very low threshold, one positive staff member, and that creates an outbreak. And remember, because it's in the community and staff may not be symptomatic, they can potentially spread the virus. So I think we're fortunate on two fronts for our long-term care facility. So first of all, it's hospital EVS staff that clean that environment. So it's up to hospital standards when we actually do the cleaning. All of our IPAC practitioners support that LTC facility because they are our licenses. So it's, again, hospital level IPAC procedures. And then all of the physician and consultant staff that work in the hospital support that environment as well. So it's an extension of the hospital. And in fact, that's what we've been doing when we go to a whole host of other long-term care providers. And, our key supports, the most, we get a daily report from the region coded red, yellow, and green on the troubled LTC facilities. And Villa Colombo, Villa Lombardo, and another home in Vaughan actually have been the three hotspots where we've actually been deploying staff. Our IPAC team goes in regularly to give them better understanding what to do. We've given them support of giving them PPE that they may not have access to. So we're supporting many others. And again, the best thing that we did, we're very unique, that we actually created a 7-day-a-week hotline number. So if someone gets in trouble, we deploy them. The challenge for LTC, and I want to maybe, again, this is my perspective, and it is horrific what we're hearing, and obviously the Canadian Armed Forces report is a challenge. The biggest issue that happened in LTC is they became short-staffed. So some of the things that you're hearing are not typical of any of these homes, but when you lose 80% of your staff, then you're very challenged to do anything. Cleaning, providing meals, attending to residents. And unfortunately, either their staff became sick or just were too afraid to work. And that was the number one issue. So, we've been fortunate that because we didn't see the same surge, we had available staff. And again, very proud of our staff that volunteered to go into these environments and support these homes.
Thank you, Altaf. My last question through you, Mr. Mayor, to Altaf is your satellite site on Jane, just north of Rutherford, the acute care center, which people use as, an off hours or outside of their own GP's office to visit. And I know I've used it many times. It's superb. It was closed. Is it open now?
It is still closed. So again, for us, it was getting as many staff as we could into the hospital. So that was the focal point. And our merge volumes dropped so dramatically, it was not viable. We were seeing maybe 1 or 2 patients come to that location. I think in the next couple of weeks, as we see volumes pick up, we will reopen that site. And we're also potentially looking at creating a second assessment center in Vaughan to provide more capacity for testing.
Excellent news. Thank you very much. And again, my thanks. I can't begin to tell you. I have a niece who's a doctor, and I am so proud of all of you and the work that you do. It's absolutely remarkable. And again, my thanks to you. And if you need anything, don't hesitate to ask. And we're all here for you, and we'll do whatever we possibly can. And unless Councillor West wants to, I'll move to receive Mr. Stationwala's presentation with thanks. Thank you very much. And please give my best to all the essential workers.
Thank you, Councillor Silvitz.
Thank you. We will have that for a seconder. Councillor Chan. Sir.
Thank you, Mr. Mayor, and thank you, Aleph. And two thanks I want to say through the mayor. First, my heartfelt appreciation to everyone involved in Mackenzie Health, of course, in all healthcare sector, in really addressing this very difficult time of ours, the public health crisis. So I just want to say to you, and please also relate to all your staff in Mackenzie Health, that thank you. And you folks are really, truly, at this point in time, our heroes, because you are safeguarding the community and really doing your best under very difficult and challenging times. And secondly, and you alluded to, and I want to share also, a lot of heartwarming stories coming out from the community. And thank you to, I want to say personal thank you to Richard Tam, your CEO, so other people, because, and I know because I actually joined the community in Richmond here to make delivery of up to 12,000 face masks, 1,000 gloves, and 400 PPE. And Richard was there at the last time to receive it, but also cultural group in Ward 6 have raised $16,000 making donation to the foundation. Those are a lot of heartwarming stories. People really outpouring the heart to support our frontline healthcare workers. And it would not get unnoticed because those community spirits. And on that note, talking about community spirit, I also want to look forward as your slide talk about what about the post-COVID-19? Because there will be a time we get through this. Through Mr. Mayor, that to our CEO in Mackenzie Health, how would you foresee so far as particularly if all this smart technology the hospital has been in place could possibly align with or partner with some of the local businesses you mentioned, like CompuGen, Amico, and so on, to help in the whole recover Richmond Hill kind of situation through Mr. Mayor. What's your view on that?
So thank you, Councillor Shannon. First of all, thank you for your support and your support for PPE. And Richard did mention, obviously, your efforts with the community, both in terms of financial contribution, but in terms of PPE. And, you know, speaking of PPE, I just have to tell you, like, there were moments where we were literally days away from running out of stock. And, you know, the kinds of ethical dilemmas that we were facing, you know, a $2 mask may be a life and death kind of situation where we had to debate, are we going to keep our staff safe? Or are we going to try to do CPR on a patient? That's the kind of gut-wrenching ethical dilemmas that we had to go through, but the support of the PPE is absolutely critical. So thank you for that. So what does the world look like post-COVID? So, you know, until we have a vaccine, COVID is with us for the foreseeable future. And there's no doubt about it that GTA communities will probably never see a decline in that burden of illness. And the province is starkly different. And, you know, what we hear day in, day out from other hospitals saying, you know, I'm in Thunder Bay, we have not seen a COVID patient in weeks. Can't we resume our normal activities of providing care? The province is absolutely about a regional and a provincial response. And we're of the view that from an ethical perspective, if a community, and let's be honest, I won't go very far, I'll go up to Barrie that has no COVID. Should they be able to proceed with less critical surgeries when we have cancer patients waiting in Vaughan or Richmond Hill for care? So we're going to have to look at a broader provincial triage, especially for critical care and for important surgeries that have been canceled or that are being delayed and deferred. So that's part A, because GTA I don't see for the foreseeable future, and I'm talking at least a year, being out of this COVID environment. Now, you know, as I say, it never wastes a good crisis, and I think the reality of what COVID has done and is demonstrated by how you're looking at this council meeting. So our digital footprint with Epic and the systems we put in place has enabled us to pivot faster than any other hospital to go to virtual care. and not virtual care where it's an added bolt-on function. So what we have in our electronic medical record is actually a Zoom icon, exactly as you're using, but it's secure and it's contained, and it actually embeds the documentation and a whole bunch of the workflow into the actual electronic record. So it's as if you were actually doing a normal visit. It's not a dramatic shift from the provider's perspective or from the patient's perspective. So I will predict that the footprint of care that's delivered face-to-face, whether it's in a primary care office, a specialist office, or even in a hospital, will be dramatically different. Your pre-op visit, if you're going to have a procedure done at Mackenzie Richmond Hospital, will no longer be you coming to the hospital, but it will actually be a virtual visit. And again, looking at our technology partners, Philips, which is a global company, before we made this decision to partner with Philips for the next 18 years, about 2 years ago, they made a very strategic decision. You may or may not know, they are getting completely out of the lighting business and putting all of that sort of balance sheet cash into healthcare. And Philips is trialing with us right now wearable devices so that for our patients, we're actually looking at their vital signs virtually. We're looking at a whole bunch of diagnostics without them actually having to come into the hospital. So those wearables are there, and we will start to deploy more and more of them to our patients. So then the virtual visit isn't just about them speaking, but it's actually about looking at some diagnostic information that enables the clinician to have a better understanding of what's going on. So that's the future. And Councillor Chan, we're just on the cusp of actually being ready to go there.
Thank you very much, Mr. Mayor, for sharing your views on the future. The last thing that I just want to get a bit more information. In the media report, there was an outbreak within, I believe, a certain ward of floor within a hospital. I just want to have a sense the extent to which there has been contained. So not only for myself, but for people in the community, knowing that our hospital did their utmost to contain this. So I'm just wondering what the scope of that through Mr. Chair, or developments, I should say.
So the outbreak that we declared was on D4 Purple, and I think it will be actually cleared sometime this week. So it has been contained. And so just to understand what caused that outbreak, so that was a staff-to-staff transmission. And some of you may know that I have actually not accepted donated food into the hospital. And this is part of the reason. So this was actually staff not practicing social distancing in the team rooms and in their local environment. So it's amazing, and it's probably no different than any other human being. You're very vigilant when you're in the healthcare setting. And then when you get sort of into a space with your colleagues, people let down their guard. So they were not wearing their masks. And one staff member was asymptomatic, but actually had it and infected another staff member. So it was not a staff to patient transmission, it was a staff to staff transmission. But it fits the definition of an outbreak. So obviously public health declared it an outbreak, but I believe it will be cleared because we've swabbed everybody. There's been no further transmission. It will be cleared imminently. But I do want you to realize that there will be more and more outbreaks. And as we open up society, and the fact that the challenge with this virus, the biggest challenge is you can spread when you're asymptomatic. So that is obviously the danger. You could feel perfectly fine and be a spreader. And that's why, you know, the things that we saw at Trinity Bellwood, they're frightening things to see because people don't know if they're actually infected. And you know, again, my philosophy more than anything else, but if you look at the epidemiology of this, the area under the curve is the area under the curve. So we flatten the curve, but we prolong the length of the curve. So it doesn't mean that less people will get infected. Until we have a vaccine, people are going to get infected. So it's going to continue to spread. We're seeing about 400 people being positive every day. You know, that's going to continue. Eventually, the virus will burn out because it will create enough herd immunity or have infected enough people. We're not there just yet. But again, realizing that the majority of people, even when they do get it, so even our staff members and others that have actually acquired the illness, either in the community, for example, they all come back fine. right? So the unfortunate tragedy is LTC, where 80% of the deaths have occurred.
Thank you so much. So my last word is thank you so much to the healthcare sector and everyone in the Mackenzie Health. You deserve our heartfelt support, and thank you. And these are difficult times, and thank you, Mr. Mayor, for allowing me to share and get some information from our colleague in Mackenzie Health. Thank you.
Thank you, Councillor Chan.
You're welcome.
Councillor Munch? Councillor Munch?
Good day. Thank you. I just had to unmute. Thank you, Altaf. It goes without saying, I think everybody feels the support that you're giving. Thanks. I have some questions based upon what you said today, and then some questions outside of that. I guess starting with your report, with regard to the Davies Award, how often are those handed out? I think you said that 2 hospitals in Canada, or we're the number 2 in Canada. So how long has this Davies Award been around? How do we apply for it? Is it something that's done over time? Give me the feedback a little bit more, elaborate if you could, please.
Yeah, so the Davies Award is issued by HIMSS. HIMSS is an international assessor of electronic medical records. It's provided once a year. The majority of the hospitals that receive it are US hospitals or in Europe, where there's a greater adoption of electronic medical records. Canada has been a little bit slow in adopting technology, so it's just unfortunate that there haven't been a lot of hospitals that can apply just because they haven't made the investments that we've made. Now, that will change dramatically in the next couple of years because more and more hospitals are doing exactly what Mackenzie Health has done. The other hospitals that have typically won it are mental health hospitals, so that's why from an acute care perspective, we're kind of unique. The threshold of the award has changed. So in the past, you could be an MRAM 6 or an MRAM 5 hospital and apply. That no longer exists. You have to be MRAM 7. So the award criteria has changed. That kind of makes it unique to us because we're the only acute care MRAM 7 hospital. So it's provided once a year at the HIMSS International Conference. I think it was to be presented in Florida this year in the month of February, but unfortunately that conference got canceled because it's international healthcare conference, and obviously with COVID going on, that would not be an appropriate thing to do. So again, very, very pleased by that. That's the background on that award.
Thank you. I think it's great news. I think it's a great achievement, and I think it's being lost amongst the other priorities that exist. So congratulations really on that. Well done. With regard to coming back to COVID a little bit, converting day surgery into assessment centers, I believe you said there was 15 ICUs. Specifically, if you look at some of the lessons that say to have been learned, as I understand it, with dedicated hospitals in Italy, Spain, and in China, have we been looking at dedicated, unique spaces? Leave that there. I got to follow up, but start from there.
Yeah.
Do we have dedicated?
So there was a point, and we were very close to, executing on this. We were about to put a field tent up, a 90-bed field tent, very similar to what you would have seen at Joseph Brant, and Royal Victoria's also put one up to create additional capacity just in case the surge happened. So that was sort of some of the effort. Our ICU numbers have been fine. So those 15 beds that we created in that day surgery space aren't needed at this point. So that's why we're going to actually start to open up day surgery there. Now, does it mean that we're out of the woods yet? No. So what we are preparing for as a province is the fall surge. Right, so we're getting ready. The prediction is October, November. You're going to have more COVID activity with flu activity, which will again put us in dramatic surge. So what is going to be the piece that kind of ebbs and flows is the scheduled surgical activity, and it's unfortunate. It's a sad state, but it's not unique to us. It happened in the U.S. as well. Where we don't have so much extra capacity. The only way we create capacity is by deferring another part of our active care, which will be scheduled services. So if another surge happens, we will probably, we've done it before, we can repurpose that space again and look at our day surgery space as ICU. But in the weeks to come, we are decanting, or I guess returning that space back to what it was intended to be used for, so that we can ramp up our surgical volumes. The benefit we have that actually no other hospital has in this province is the second site, and that will obviously enable us to create a huge amount of capacity, and we're very fortunate to have that.
So along that same line, we've done 4,000 virtual calls. Those virtual calls are predominantly COVID-based or general calls, or has it been, sort of what is the breakdown on that?
Yeah, so a mixture. So those 4,000 calls were really to help family members connect with their loved ones. So obviously, if you've been in the hospital, our inpatient units have a tablet attached to the bedside table, and they can use that as well. But some of our elderly patients are not so capable from a technology perspective. So that's our frontline providers helping them use that. But what we're seeing is literally probably about 150 to 200 virtual consults happening every single day in the hospital. So that is the numbers that you're going to start to see spike up, because our objective still in the direction from the province is if you can keep people out of hospital, keep them out of hospital. So for example, all of our surgical pre-consults, as I indicated, are now going to be done virtually. And if we can pull some early trials off with Philips and start to provide wearable devices to some of our patients, then we can actually do more intensive consults as well.
So are we looking, or has there been discussion, and if you can't disclose, that's fine too. Are we looking at dedicated hospitals or dedicated healthcare? I think of Branson Hospital and some of the other areas. We were looking at our library to be used for at one time for some support. Has that been a discussion? Is it an ongoing discussion? What's going to happen in the fall?
Yeah, so we have looked at all those plans. There was a point, again, no one knew what the modeling was going to look like. So we had discussions actually with Alex Mack and the region school board to look at using some of the space in the school across the street. We have active relationships with hotels as well. So the efforts over the summer will be now, how do we get ready for the fall surge? And I think where it was very much each hospital to itself, prepare for what you need to prepare for. I think now that we have a bit of time, there's going to be sort of provincial efforts. So case in point, Royal Vic put up a field tent for about 90 beds. That's not a resource just for Royal Vic. It's a regional resource so that if we're in surge, we can access some of those beds. And that's really the way forward. It was a bit chaotic where everybody was doing their own thing and spending money. And remember, that's the other part of this, the day of reckoning for all the dollars that we've spent. Like I have spent millions on PPE, millions. And, we have to reconcile those dollars. So we have to be a little bit more, I think, cooperative in our efforts. Everybody can't do their own thing because we just won't have enough money to do it.
Thank you. Two questions left on my docket. May have a couple of others, but with regard to testing speed, I'm involved with the Coalition of Concerned Manufacturers of Ontario, and many of our members have converted our manufacturing facilities to assist in the effort. But the question I ask is with regards to testing speed. U.S. has got, reports came out yesterday with Donald Trump and what they were doing there with regards to, a less than 20-second tests. What is our testing speed? What are we doing with regard to technology? How are we in Richmond Hill and in Vaughan by our double hospitals? How are we getting priority over those new types of equipment? What are you doing to try to get the up-to-date, to make things done faster, all the things around testing? Can you help me out there?
Yeah, so, we're still obviously in emergency measures, and a hospital can't independently take action any longer. So my ability to secure something ahead of somebody else, those days are gone. I'm glad that we made the investments that we did when we did on some of those fronts. So the testing is really sanctioned by the province. Provincial lab has authority over the nasal swabs that are being used right now. It's a molecular test. It has a turnaround of a couple of hours, but it's not so much how quickly you can process, it's the sheer volume, the fact that the processing is centralized. Now, we are provided once a week 100 additional localized tests from the province, which have a turnaround of less than half an hour. What we do is we use those tests for our surgical patients, because you can imagine that if you're doing, so assume that in our environment, unless you're tested, you're assumed to have COVID. So all of the protocols of having all the PPE and everything else have to be done. So if someone is suspect COVID, the amount of PPE in the protocols, a procedure that takes a half an hour takes an hour and a half, 3 times the length. If we can do a test on a patient and say they're no longer suspect COVID, then we can run the cases that much faster. So those tests, I wish we could get more. We're only provided 100. Each hospital's provided 100 a week. We use them for our surgical patients, and then we use them for some of our inpatients so that we can start to understand very quickly who's COVID positive, who's not. The assessment tests are still done at the provincial lab. They are telling us they're going to get faster and faster. Molecular testing is very, very expensive. The reagents, and that's a rate limiting step. The reagents for molecular testing are in short supply, and they're very, very expensive. So there's only 6 or 7 labs in the province that can do this. And even if I wanted to, I couldn't do it at this point.
Are there, so how often do you get in contact with the province? Are you having daily, I assume you're doing daily conference calls or daily discussions. How is that? Can you tell me sort of what your protocols are?
Yeah, so again, you know, the government is running the entire healthcare response under the Emergency Measures Act. So everything I do through orders. They're legal orders, where if I don't comply, I go to jail. That's the significance of the current command structure. So again, that's the environment we're in. So absolutely, Councillor Munch, there are probably half a dozen calls every single day. It's like just like you, it's kind of a Zoom marathon, and for us, unfortunately, the directives change. They typically do it on a Friday evening or a Saturday morning. We'll get issued new orders. So case in point, the orders to open up the testing criteria occurred on Saturday morning, which meant our entire team was here on the weekend, adjusting all of our practices and our capacity to deal with more testing. So that's my sort of life day to day. It's being directed what to do and then complying.
Last question for me. You mentioned 1 year is sort of the threshold that you're rushing right at this point.
Yeah.
Why 1 year? General across the board at your?
So there's no science or evidence to say it's 1 year or 6 months. It's really predicated on having a viable vaccine, having that viable vaccine manufactured in reasonable quantity and deployed. And so you know, you saw the mad dash and the craziness around PPE. Can you imagine what's going to happen when they actually have a viable vaccine and and people are, and who's going to get it and how they're going to get it? It's going to be, anyway, you know, it is going to be a challenge. So I think we have to be ready for that. When will that vaccine be ready? Until we have a vaccine, we don't really have a way out, and we don't have the luxury that other parts of the province have, which is maybe a greater degree of isolation. The GTA is a porous environment, and I think we're going to continue to see hotspots, if not full-blown waves happening again. You know, they suggested the numbers went up last week and early part of this week because people were not disciplined during Mother's Day, right? So remember, the life cycle of this is always, you know, a 14-day period. So, you know, whatever happened from the great weather we had on the weekend, we'll see again in 14 days what the implications of that are.
Councillor?
Thank you. I'm sorry
I'm just asking her.
we spend so much time on one topic.
Okay. Thank you then. Yes, okay, thank you.
Mr. Mayor, I didn't raise my hand earlier.
I know. Okay, go ahead.
Thank you. Just quickly, I also want to thank you, Altaf, for all the work that you and your team have done and what you're doing during this time. Thank you for acknowledging my wife and I's small contribution there. I just have a quick question with regards to the finances of it all. We appreciate you reporting to us. Obviously, the province is responsible for the financing of the hospitals, but if you could just quickly give me an idea of what the financial impact is for Mackenzie Health, and so I can kind of multiply by times the number of hospitals in the province and see what hospital care is costing.
Yeah. So, we have had no funds flow from the province for the COVID response just yet. And obviously commitments continue to be made on our behalf. So for example, and absolutely deserve the $4 premium for all hospital staff and frontline staff. That's a multi-billion-dollar commitment that's been made by the province. We have to disperse those funds and those dollars will have to flow. The response and the deployment of all my staff into other environments like long-term care facilities, again, that's not part of my normal job accountability, but those are things that we had to do to support the response. We are funded on an activity basis, so I get funded for how many hips and knees I do, how many cancer surgeries I do. Clearly, we haven't done any of those procedures at the same scale, so I can't recognize that revenue. So, Councillor Deputy Mayor DePaulo, there will be a massive reconciliation. What the province has said is please capture all your incremental costs. So there are very structured templates that we're filling out on a daily basis, capturing those costs. The allocations you've seen of about $350 million of additional support that's going to be provided to healthcare from the province. The feds are also contributing, and I don't think anybody is going to nickel and dime hospitals or healthcare organizations. I think what has to be funded will be funded. The traditional way of measuring us on our efficiencies, like there's no benchmark that you can use to measure how well a hospital is from an efficiency perspective in the current environment. The world has been turned upside down. So the assumption is that, the support that you provide as council is the same degree of support the province is going to provide. And I would argue that the hospitals are the ones that have stepped up more than any other component part of the system in long-term care. If you heard our Premier's comments yesterday around the LT response in county, he thanked hospitals 8 times in his comments. So, I think the assumption is we have to be funded and understand that we not only have to be funded for the COVID response, but we have to be funded to open a net new hospital, which is another $270 million of operating dollars that have to be flowed. So there's a lot of money. I don't know how we're going to reconcile this at the end. Our poor grandchildren will be paying for this for the foreseeable future, but we need to sustain hospitals because we're obviously core to this response.
Great, thank you. Thank you.
Okay, thank you. All right, I now want to thank Altaf very much for the conversation. Certainly COVID-19 is something that we do care about, and it's a health issue that we're dealing with, and we know that. And you'll find that at a regional meeting which is tomorrow, we'll have a similar discussion of this at the same amount of time. We all try to understand how it's helping us, how we can help it, and always just being thankful to our leaders, and one of which you are, sir. So thank you very much. I appreciate that.
Well, thank you all. And again, we'll continue to provide you with the stakeholder updates. We usually send them out on a Friday every 2 or 3 weeks. So please use that information to share with your constituents. It's, again, the best information. There's a lot of misinformation out there as well. So please use that as an update that you can then share with your constituents, whether it's around the assessment center or anything else that's going on in the hospital. So thank you for your support.
Thank you very much. All right, we do have a mover and seconder. All those in favor is for just receiving the presentation. Opposed? That's carried unanimously. Thank you. And thank you. All right, we are going to move to the third 10.3, the presentation by Paulo Macero. now because there's other staff involved with this. Not that Grand Dempster is put in place in any way, but if we'll do that later. So can we bring forward Al and his team? There we go.
Good morning, everyone.
There we go.
Good morning, Mayor and members of council. I'm here today to provide an update on the Civic Administration study in support of staff report. That's item 12.6 on today's agenda. Next slide. The concept of a civic precinct project on our city-owned lands exploring combined city hall and central library was contemplated going back to the 80s. The project was a vision to revitalize that downtown core by introducing civic presence and to maximize the value of that land on Yonge and Major Mac. Subsequently, the capital project for that was approved in 2017. However, in mid-2018, council deliberated on the merits of combining that city hall and a central library over at Yonge and Major Mackenzie. Next slide. So here's the graphic representing some of the key milestones that can be found in the staff report, as well as Collier's study that goes into more detail. However, this is intended to summarize the lead up in the early 80s in the development of the Civic Precinct project and a variety of studies and directions from council in the 2000s. More recently, the council approval of the funding and financial plan for the project that happened in early 2017, after which staff received a change in direction later in 2018. So a little bit about that change in direction, which is why we're here today to report on those findings. City Council directed staff to revisit the administrative space requirements and investigate different locations and options for City Hall accommodation in a 20-year outlook. So the purpose and the objectives of that study were to revisit all that space and the requirements needed to create a space plan that balanced functionality and, more importantly, fiscal responsibility. A full range of alternate options to accommodate our growth we're investigating and making sure that our staff exercised all their due diligence for that 20-year lookout. Next slide. So here, summarizing the incremental needs on this slide, we see that for a 20-year outlook, an additional 14,000 plus square feet would be needed. However, when you look at the portion of the slide below for the 2026 outlook, there's more building space than we need. And that's simply taking the 135,000 plus square feet being less than the 144,000 plus that the current building provides for us. And that's available, usable space. So while the current crisis, as unfortunate as it is, it also presents an opportunity for us. And it's likely that those 20-year long range needs will more than likely be reduced. So in short, if you're wondering when we're going to run out of space, we're definitely good to 2026 and the foreseeable future. What is known is that the rate of change today is significantly greater than it ever has been. So it's recommended that we always look at these long-term projections and needs continually every 2 to 3 years. Next slide. So here we have a sample of the new space standard that was developed as part of the study, and it demonstrates the maximization of space here at East Beaver Creek from existing to proposed. Some of these assumptions and decisions were made as part of the study, and they were based on these draft standards that referenced very often in the study. So you can see the differences in some of the office space sizes being larger, and then in the future being further reduced. And those reductions range depending on the type of office size from 20 to 50%. Next slide. So when reviewing all the options considered, it's important to also note that other departments such as planning and legal were consulted. It's the reason, for example, the DDO was not selected to be pursued as one of the 6 options. It was deemed unsuitable naturally for development of an office building, also because it's a protected cultural site. This is merely to demonstrate that all available possibilities within the city of Richmond Hill were explored. So you can see that there are 3 distinct categories being formed: new construction, renovation expansion, and renovation and satellite. The new construction options included Richmond Green, city-owned lands referred to as the Brody House, and New Market construction. Reno and expansion included East Beaver Creek and Market Available, while Reno and satellites referred to East Beaver Creek and the Operations Center, or East Beaver Creek and Market Available. So for context, when we talk about Market Available, it means sites that were investigated, but we didn't identify specifically where they were to address and preserve the confidentiality of those property owners that we were dealing with in the event that the city were to proceed with and move forward with one of those options during negotiations. Next slide. Some of the risks and opportunities with these options include, but aren't limited to, as part of the study, actual city staff growth that may not match projections. So if we break that down for a moment, it could be considered a risk if the city grows faster and greater than we anticipated. However, in view of the changing environment, the probability of that's quite less likely, and it's expected the city has more building space than we need. And we can also turn that into opportunities for leasing down the road. Parking pressures. While it could have been considered an issue if we looked at our 20-year outlook growth projections, again, it's also clear moving forward as we move towards a digital workforce, also accelerated by COVID-19, this too may no longer be a risk and rather turn into an opportunity. It's also important to note that the city has, within this site, the East Beaver Creek site, it's subject to a reciprocal agreement with private sector parties. As we know, that's the Sheridan and the Plaza people, which may restrict the city in determining what can and can't be done. So we looked at that as well when we looked at all our options. So depending on the option that was selected, some impact the agreement, but others, such as option 5 that's being recommended in a report, do not. And just circling back to the adoption of some of those new space standards that I touched on earlier, if we were to apply those new standards, it would create approximately a full floor of available space if the entire building were to be renovated. And that's looking at just under 20,000 square feet. Next slide. So really quickly, just so you understand, what are the things that we looked at when we were reviewing all the options, and a scoring matrix was put together to score each one of the options. So to assist in defining their criteria for the suitability of all the options explored to meet the direction of council and needs for that 20-year outlook. These were the guiding principles that were used in the scoring matrix to determine the best option. For context, these were the same guiding principles developed as part of the Civic Precinct project, and it still remains relevant for the purposes of this study and update. But it's important to note that in light of that direction provided by council in June of 2018, certain principles were given more weight than others, specifically principles related to balancing financial impacts and flexibility of implementation. So basically, we were taking lessons learned a long time ago and recognizing that, you know, we might need to look at things a little differently. So since the rate of growth in staff might occur slower than forecasted, options that can be phased in rather than undertaken all at once might be preferred. And that being the case, therefore, options 1 through 3 might be less desirable and would score less as compared to options 5 or 6. Next slide. So here's the important slide, the findings. Just focusing on the option 5, the area highlighted in red, it summarizes the results that demonstrate that option 5 is preferred due to its flexibility and the option that buys the most time and therefore is most financially sustainable. It provides sufficient space to 2026 and beyond at a cost of $41.8 million, and that is, for clarity, for full implementation. Option 5 doesn't impact the reciprocal agreement as mentioned, that the city has with other East Beaver Creek stakeholders, while option 4, for example, does. Next slide. So focusing on the needs to 2026, as mentioned earlier, when we look at that shorter term outlook, it demonstrates that additional space is not immediate or urgent, and the city's in the process of exploring options for a digital first delivery model. Since the completion of the study, it was identified that, should the growth estimates change, there'd be a corresponding change in space needed. So it's apparent that given the current operating environment, that post-pandemic accommodation opportunities will definitely present themselves. A cursory review has shown that the original projections could even be lower than those we looked at within the Colliers and are contained in the Colliers report. So once working remotely, hoteling on a more permanent basis where feasible is accounted for. So while projections and space requirements have evolved since we initiated this study, the 6 strategic principles that I talked about earlier still hold true in determining how a renovation can be undertaken. Next slide. So moving forward, the ability to leverage the operations center was also identified as a suitable satellite candidate as part of option 5 to the existing building at EBC. So while the study identified that the space over there could be used to meet the incremental need, it's the additional square footage for that 20-year outlook. On the short term, more immediate opportunities present themselves. For example, using it as a swing space solution for future renovations, greater lease opportunities at East Beaver Creek or the operations center, or to revisit more of a citizen-focused serviced approach at either one of the locations. Next slide. So you can find this in the study as well. As part of the study, all the departments were requested to put forward who they thought would be candidates for permanent satellite locations. However, for some groups, now that we're in the midst of COVID, it was realized that a few of these candidates listed here could potentially work remotely permanently following the city's transformation to a more digital workforce. And that process is underway. Also important to note that we have about 131 staff here. That represents about 17,000 square foot of usable space that could potentially be moved out of East Beaver Creek. And that's applying the new space standards. In addition to, we're also aware that the changes to the environmental services division, there's approximately 20 staff that will be transferred or have been transferred from my commission over to the Public Works Division. That to some extent demonstrates that we've already initiated some of the opportunities to open up space here at East Beaver Creek. Next slide. So a little bit of a timeline, and I think it's important to just very quickly highlight that if we were to adopt option 5 in its entirety, we can do a full-blown implementation, full renovation in 5 to 6 years. However, we could extend that if that was the desire and will of council. So given the projections to 2026 that show that the current state of East Beaver Creek doesn't require additional space anytime soon and it's less immediate, the timeline can be extended. So it's important to note here that moving forward, one of our next steps is project definition, or also referred to as detailed programming. It's required for any building renovation, design, and construction. It's basically the plan that describes the steps and the sequence that we need to go through before we actually get to full-blown design. It's confirming who goes where, how many people can be relocated to where and when, and building condition assessments and things of that nature. So that needs to be carried out to complete a project on time and on budget. And for my commission, that's always a near and dear, making sure we deliver things when we say we're going to, costs, dates for all those tasks and whatnot. So next slide. So in the spirit of customer service, it's clear that the outcomes of our recent telework pilot project that was launched last year provided the readiness for everyone in the city here to be successfully deployed and transitioned during this pandemic. And that policy can be further leveraged to realize more space in the future at East Beaver Creek once we start to see the provincial restrictions being lifted. So our citizens here in Richmond Hill expect more transparent, accessible, and responsive services from us in the public sector. And as those expectations increase, there's going to be societal shift to digital. It has always been out there, however, maybe not so much in the public sector. And so for the city, it's now about and has always been about the adoption of this digital workforce. And that's what we're also in the process of doing. So as it relates to accommodation planning, we aim to establish work locations and needs that are aligned with some of these key services. We're going to focus on the permanent remote, partial remote, and as mentioned earlier, also the never remote, and determine how we can implement shared bookable spaces, conference spaces, et cetera, and some of the tools as we move towards a digital workforce. So some of the considerations for implementing option 5, to summarize again, we're not running out of space in the near future. And if you're wondering why option 5 and how much time does it buy us, touched on this a little bit earlier. We're good until 2026 and beyond. The long-term projections and needs should be reviewed every few years to ensure that we continue to evolve as we become a progressive municipality, and always making sure that we're not using old information and old data. Things are changing faster these days. So the study sought to ensure that we had space for a 20-year outlook. However, lessons learned from COVID has identified that there will more likely be more space realized. And this is why option 5 provides the most flexibility and buys the most time, if that's the will of council, if we want to deliver this over a longer period of time. Next slide. So summarizing the recommendations from the report, some of this becomes repetitive, but they're important themes. Significant benefit of option 5 is that it can be actioned incrementally. We can do it in 5 or 6 years, up to 15 years. Each incremental phase can proceed as actual city growth and space requirements are realized. And this is why proceeding with steps 1 to 3 that are identified in recommendation E in the staff report related to the East Beaver Creek location here and the available space at Operations Center is a reasonable approach. This then helps us formalize the design requirements for item 4, dealing with the balance of EBC. So that's basically saying we can focus on the ground floor here at East Beaver Creek, the space at the Operations Center, and we can renovate a floor at a time if we like. That is purely flexible, and those are some of the things that we can roll into the 10-year outlook. Staff projections and space requirements per staff member. It's important to note that that's what forms the foundation for the area of office space that we need. So that approach ensures that space needs are based on the most recent and actual data that informs the design and construction as we move forward. Next slide. So in conclusion, the preferred option 5 identified in the staff report as well as the Collier study, it does meet the primary strategic objective of the Civic Administration Accommodation Study by creating a plan that balances functionality. And most importantly, I recognize that this is near and dear to everyone's heart, especially in the current pandemic, financial sustainability. The flexibility of this option means that it can be actioned at any time as space needs present themselves. And just to reiterate, that particular option is compliant with all existing zoning bylaws, or in some instances, other options are not. Doesn't impact the reciprocal agreement, and it's the overall lowest risk option. So that concludes the presentation. At this point, I'm happy to receive any comments or questions.
All right, I'll ask for people who wish to speak. Okay, thank you, Councilor Barros, Councilor Paula, budget man. Anyone else wish to speak at this time? Just so I have a list and I don't have to. Thank you, Councilor Chan. Okay, with that, Councilor Barros.
Thank you very much, Mr. Mayor. This has been a topic that Richmond Hill has had for a number of years, as we've seen from the beginning of this. And I think we've found ourselves with an option that really kind of fits for our current environment. So I'm happy to move the motion to support option number 5. I do have a question, though, through you, Mr. Mayor, to the interim commissioner. The question is, so there's a $41 million earmark for that eventual work. I guess the question is, we'll recognize some revenues from leased spaces. Will the leased spaces over a period of time pay off that $41 million? If
Through the mayor to Councillor Barrows, that's an excellent question. I can tell you that that has been in the back of my mind as we've had ongoing discussions about how do we find ways to leverage this space here at East Beaver Creek. So that's definitely a financial approach that we could use, that if we wanted to lease space here, generate that revenue to offset the cost of renovations in a phased-in approach. I think that's a very reasonable approach.
Okay, because thank you. Because the situation is, as I understand, $41 million. It can't come from. Well, it can come directly from tax rate, which we don't want to do. It can come from reserves, which we don't want to do. We want to save that for residents, projects that they see as a benefit on a daily basis. And we're not able to provide any sort of development charges for administration buildings. So we're quite limited on the funds to actually do this type of renovation. So while I'm moving this motion, I need to understand that we're not moving forward on expending any money at this time. Is that where we're at through you, Mr. Mayor?
Hello?
Yep, through the mayor to Councillor Barrows. There are some remaining funds through previous Civic Precinct project accounts that the report seeks to authorize use for to initiate some of the first steps of moving some staff over to the operations center. There's a detailed programming work that needs to happen to make that happen, as well as if there's the desire to make our first floor of East Beaver Creek more citizen centric and focused. We want to be able to leverage some of those funds in order to enact some of those decisions.
Okay, but there's no additional money being requested here. That money's already been put aside for previous, is what I'm hearing. See, because when it comes to the long-term plan, I guess I'd be wanting to hear back from the commissioner at a future date. Because if we're going to be spending money on renovations so that we end up using less space, but the space that we rent out, if it in the end does not pay us back on the renovations, I would be of the opinion at first blush to just say, fine, use the larger space if there's no return on our investment there. Now, that would have to be flushed out and presented back to us at another time. But I mean, obviously none of us, I don't think, would want to go and spend money recognizing that we're not actually going to ever get it back. I don't think that would be wise expenditure either. So I'm happy to move it. One last question, Mr. Mayor. That remaining budget is how much?
Through the mayor to Councillor Barrows. One moment, let me just refer quickly to the report. It's approximately $500,000. There's two accounts that amount to just over $500,000.
Okay, and that's what I thought. I didn't think it was anything. And it's a lot of money, but I didn't think it was in the millions of dollars that we're looking to expend. And I think everyone would agree that our main entrance to East Beaver Creek hasn't been touched in the time that we've moved in, and could use some sort of a refresh. Now, although it's not listed in the report, as the chair of the Richmond Hill Public Library, I'd like to at least have a discussion at some point with the city to look at potentially a satellite location at one of our libraries for Access Richmond Hill. For instance, Yonge and Major Mackenzie is where we spoke about having a potential city hall at one point. So it would seem to me to be appropriate if we were looking to distribute some of our access people across the city to make it more convenient for residents, that our libraries would be those locations. So I put it out there for future conversation, and I'll reach out to the commissioner for that conversation. But at this point, Mr. Mayor, thank you for the opportunity. I think we're moving forward in a great step here to do this. Thank you.
Very good. Thank you. Councilor DiPaolo, budget man.
Thank you, Mr. Mayor. I think Richmond Hill's in a great situation with the building it owns now, the flexibility to expand and contract our office space use. And, I appreciate this study. It does seem like we're saying we don't need any more office space, but it's going to cost $41 million. But I do understand the need to renovate. The ground floor and the first floor have to be more user-friendly for our citizens. Residents of Richmond Hill got to feel more comfortable coming in. It's got to be more self-explanatory about how they can interact with their city hall. So I'm all for doing that. I think effectively, I will second the motion by Councillor Barros, because I think effectively this is going to take off $110 million on our 10-year capital planning. It's going to reduce it. It's going to put us in a policy direction. We're making a statement that we no longer require a new city hall. We're making that policy decision, but no money's going to be spent until this council has a chance to review options and details, and we'll know the funding sources. And this is a very general direction. I'm in support. And in fact, Mr. Mayor, I really want to congratulate you and the previous term of council for the decision you made in 2018 or 2017 to cancel that Civic Center project. Had we been now in 2020 in the later stages of a construction of a $100 million project for more space, the council really would have looked foolish. It was very wise, very forward thinking to make do. And I think as we go forward, we are actually going to require less and less real physical office space. We're seeing right now the changing type of office environment. And I think Paulo's plan here really reflects that. And I'm happy to support the motion. Thank you.
Thank you, and thank you for that. Councillor Chan.
Thank you, Mr. Mayor, and thank you, Paulo staff, for really, I would say, easy to read, but also a report that providing a good analysis and listing and tabling all how much it would be. We are talking about how long would be the whole cycle for all the 6 options. Thank you. And I would also support the motion in terms of this option 5. Certainly, it saves money. And also, it meets our in terms of the estimated growth until 2026. But things are also changing so quickly. I mean, it's definitely with the COVID pandemic we're having, it's certain shift, not just Richmond Hill, the whole kind of work. In terms of accommodation, we really have to think about, do we still need that much space in the future, and how the digital thing can help us. So I think we're going the same direction. But also 2 comments, and then maybe I have a question from Paulo through you, Mr. Mayor. One comment is that because if it opens up the 225 East Beaver Creek for other opportunities. I understand we talk about leasing, but from a service standpoint, I think that there will be opportunity for Access Richmond Hill or the City of Richmond Hill to engage Service Ontario at the provincial level, as Service Canada at the federal level, to be one-stop kind of government services of all three levels right in the heart or in the building of Richmond Hill, because it that's one thing. It make it easier for residents of Richmond Hill to access all levels of government services. And number two, I think for us, it would generate revenues depending on our agreement with the province, with the federal government. So those are good things. And the question I have for you, Mr. Mayor, is to Paulo regarding the parking. It mentioned about the reciprocal agreement. So to what extent the parking could be, I gather, in terms of the tightness or space issue can be mitigated further with this kind of the option 5 arrangement for you, Mr. Chair.
Thank you. Through the mayor to Councillor Chen, great question. The report speaks to this to some extent. If we were to fully realize growth projections, parking would be a challenge. As we know, it's a parking already today when there's large events at the hotel. Some of the suggestions in the appendix of the Collier study done by one of the consultants suggested that on those days, you look to have staff telework. Guess what? It's what we're already doing as a result of the pandemic. I think it's safe to say that the more that we continue to embrace a digital workforce and less people are coming here to East Beaver Creek, that parking is not going to be an issue moving forward.
Okay, thank you. So in the closing, thank you, staff, for a really thorough report. And I'm happy to support the option 5 as part of the motion. Thank you.
All right, thank you. I had no one else wishing. Oh, sorry, Councillor Silovitz, please.
Thank you, Mr. Mayor. Through you, thank you, Paulo, for this excellent report, and to your staff for compiling it. Just one question I'd like to ask through the mayor. What considerations are given to extending the amount of electric charging vehicle stations? We only currently have 2 outside 225 EBC. In anything that is considered here, I would hope that is a part of any and all considerations that are being undertaken by staff right now.
Through the mayor to Councillor Silovitz, great suggestion. That was not part of the scope of this particular study or assignment. That's a separate exercise that a variety of departments collaborate on. Development Engineering, Public Works has a few up at the Operations Center that they maintain. Separate exercise from this particular one for this report.
Okay, thank you. I'll have a further discussion with you about this offline. I believe it's something that we should look at, because most of the time it's my understanding that those 2 charging stations on the upper, the northern lot to the north of our building, a lot of the time it's being used by the condo residents who live in the condos further to the north. So they're always being used. I don't have an electric car at the moment. I will eventually have one. But I do believe that in keeping with other direction that has been made by this council to developers, that they should look at the incorporation of a greater amount of electric vehicle charging posts, that we should look at this as well if we're looking at the renovation and the modernization of our main building at 225 East Beaver Creek. So I just wanted to bring that to everyone's attention, and I can have a further conversation with you offline, Paulo, and we can figure out what to do about that. Okay, thank you so much.
Thank you, Councillor West.
Thank you, Mr. Mayor. Just before I start on that, I would hope that the EV charging station thing would be a part of what staff would be seriously considering, given the climate change motion that we passed not too long ago, that was one of the specific items, but also that we are to be looking at all of our decisions through a climate lens. And I would assume that's pretty low hanging fruit. So I would assume that as we move further down this road, that we would be examining that. I'm happy to support the motion before us, given the decisions that we've made leading up to this. I think that one of the things that I find most appealing about this is that there will be a bunch of questions and assumptions that I think we are making. And somewhat looking into a crystal ball, like they always would.
Oh, we're losing them.
The COVID situation in terms of space needs and work environments and teleworking and all that other stuff will become more clear, and we can have more confidence in what the future looks like with time. And I think that this particular approach, option 5, does buy us the most time, to use the words that Paulo said in his presentation. But it's also an incremental approach that should opportunity to make sure that our assumptions are turning out to be correct. So that's definitely a plus. I just would like to add, I actually agree with a comment that Councillor Barros made, and I'm glad that he made that comment. I would like to learn more, but I would like staff to look into the possibility of moving some of our most forward-facing services, like Access Richmond Hill, to a location that's, you know, not almost in Markham, where 225 East Beaver Creek is. And I think there is an opportunity to move some of those more forward-facing public services to a location like the Central Library or something like that, and be a part of that, you know, that part of town. I think it's more transit friendly. I think it's easier to get to for a lot of people. And I think that would be something that, if we're going to be doing all the things that we're talking about here, that I think that should be looked at in the mix as well. So anyway, happy to support the motion that's in front of us. And those are my comments. Thank you for the opportunity, Mr. Mayor.
Thank you. Okay, with that, we have a mover and a seconder. Councilor Barros, Councilor DePaulo, all those in favor of the motion, and then we count 1, 2, 3, 4, 5. Opposed? 1 opposed? No. Okay. Carried unanimously. My hand went up late, so it was, thank you. Thank you all. I appreciate that, the discussion too. It was well done. All right, we are now moving to the presentation by Marianne Dempster, interim city manager, regarding planning resumption of city services.
Thank you, Mr. Mayor. Mayor and members of council, good morning. It has been 73 days since we activated our emergency operations center, closed our facilities to the public, and took a number of measures to keep our community safe. I'm happy to say that, along with the rest of the province, the country, and the world, we are starting to take steps to reopen. Today's presentation will provide an overview of operations since March, outline the pillars and principles for recovery, and outline the phased approach we are taking. Before I proceed, I want to acknowledge the hard work of our staff. They have worked incredible hours to keep our community safe, to make sure we are equipped with the tools we need to do our work, to communicate to our residents and businesses, to respond to inquiries, and keep the work of our organization going. I also want to acknowledge those staff who redeployed to fill much needed positions to keep our parks operations running smoothly. I am extremely proud of everyone on our team. Please look this way. Next slide. Although this timeline started on March 13th, we were meeting as a team before that date as COVID-19 began its spread around the world. On March 13th, we closed our facilities and later fully activated our emergency operations center as we declared a state of emergency on March 20th. In late March and early April, in keeping with the provincial orders and to ensure the health and safety of our staff and program participants, we canceled spring recreation and culture programs and extended closures of our facilities to May 31st and cancellations of our events to June 30th. To support our residents and businesses, we waived penalties and interest on late property tax payments until the end of the year. And we made the very difficult decision to temporarily lay off over 1,000 of our staff. Next slide. In mid-April, we established the Recovery Richmond Hill Task Force to address the city's economic recovery. This is truly a collaborative effort with participants from the federal, provincial, and regional governments, as well as local business associations. As we enter the month of May, we redeployed 60 full-time staff and moved to a 4-day work week. We also extended ARH operations to 7 days a week. Recognizing the business resumption is key to smooth recovery, we activated the city's Resumption Plan Committee on May 12th. Before I outline our recovery plan, I want to first highlight some of the operations that have continued through this pandemic period. This includes fire and emergency services, waste collections, which we increased to a 6-bag limit from 3, water and wastewater services. We continue to process development applications. From mid-March to date. There were 75 development applications. Last year during the same period, there were 111. Although this is a reduction, it shows that we're still moving business forward. We also continued to process property tax and water bill payments. It's important to note that approximately 60% of tax payment transactions are done online as the normal course of business. Through the COVID-19 period, this has remained constant. Our public works operations staff continue to maintain and inspect parks, trails, boulevards, public trees, and public spaces. Our bylaw enforcement continued, and I will say it was beyond the normal course of their regular duties, monitoring our parks and ensuring that our residents and staff are safe. And city corporate services, including human resources, finance, and IT, remained normal. In addition, I want to note that we also processed 1,554 zoning bylaw inquiries. In the normal course, it's just over 2,000. There was a 25% decrease, but it shows the steady business flow of our operations in that area. Next slide. The COVID-19 pandemic tested our resilience, and I'm proud to say that we were agile. We adopted new practices quickly and adjusted our operations while ensuring the health and safety of our staff and the public. We embraced online technologies and illustrated that we can be a remote workforce and still provide exceptional service to our residents, our businesses, and our public. For example, we facilitated online council meetings, Access Richmond Hill to move to a fully virtual environment for phone and email service. The team continues to operate 7 days a week. While the park amenities were closed, walk-through access was permitted and trails remained open. Building permit transactions are now by appointment. From mid-March to May 25th, 317 building permits were issued. Last year at this same time period, we issued 356, a small decrease. We continue to inspect non-occupied premises with 2,863 inspections since mid-March. Normally, it's approximately 500,000. And we issued burial permits without incident. Our community gardens opened on May 13th, and we created the Stay Active at Home program with online activities ranging from fitness classes to gardening tips. And the theater lodged a series of online performances. We have become a digital community in Richmond Hill. Next slide. With respect to community services, our community services department continues to be exceptionally agile and is adjusting to change in both provincial regulations and public health orders. Last week, we began the gradual reopening our park amenities, and I'll be touching on that process a bit later in the presentation. We canceled festivals and events until August 30th, and plans are underway to launch a virtual Canada Day for July 1st. Performances were also canceled at the Richmond Hill Center for Performing Arts until August 30th, and online performances will continue. We also canceled registered programs, and we are in the process of canceling our summer day camps. If provincial restrictions are lifted and is financially feasible, We will consider adopting an alternative drop-in type camp program in the future, as long as we are able to maintain physical distancing and adhere to the provincial health orders, the public health orders. Our community services department, oh, sorry. Next slide. Sorry, reading the same slide again. The city resumption framework. Our city resumption team was activated on May 13th. Preparation for this team was initiated several weeks prior, and we have been gathering information from other jurisdictions regarding their resumption approach. It is important to note that the framework I'm about to present is based on what we know now and expect to occur. The timeline may change, but the principles will remain the same. Next slide. Through the city resumption framework, our mission is to restore city services in a safe and responsive manner while embracing innovation and change. As we move towards business resumption, there are a number of pillars that are guiding our actions and are embedded in every decision we consider and make. They are foundations for the actions we've taken and will continue to take. We have 4 pillars: care, coordination, citizen-focused, and communication. With care, we will resume business operations while balancing the physical and psychological health and safety of our staff, our visitors, and our residents to the Richmond Hill facilities. Through coordination, we mean that we will align our activities with the provincial and public health regulations and guidelines, and with York Region's plans. We will adapt service delivery in a way that provides for citizen and employee safety and fosters innovation. And we will continue to communicate with staff, the community, and council through multiple formats. The principles go into more detail and focus on our operations. We have 6 principles: staff safety, cashless operations, public-facing counters, remote workforce, financial challenges, and innovation. Under staff safety, facilities maintenance and sanitation, security, ability to access areas within city buildings, etc., will be prioritized to ensure a safe and healthy work environment for those who need to return to work at the city facilities. Personal protective equipment will also be available to staff specific to the needs of the areas they work. We will ensure that we maintain all provincial orders in our buildings and we keep our staff safe. With cashless operations, we will question and investigate the need to accept cash at the city facilities in light of the multitude of options that exist. In 2019, a Richmond Hill cash handling audit concluded that the city should review the level of cash payments coming in to access Richmond Hill and draft a policy limiting the amount of cash that can be accepted as a payment. With the COVID-19 experience, there is an opportunity to recommend cashless operations both as a health and safety measure and to facilitate digital transactions where possible. Staff will be reporting back to council later in June, beginning of July, on the results of that audit and how we move forward. Regardless of whether or not we take cash ongoing, we will be limiting, as we reopen, we will reopen as a cashless operation due to the health and safety risks around accepting cash. So we'll be looking at digitization, remote payments, and accepting payments through credit card and debit on in-person transactions. Public-facing counters. In keeping with the citizen-focused pillar, there's an opportunity to change current operations so that visitors who interact with city staff no longer have to do so on multiple floors. Staff will reconfigure the ground floor at the main municipal offices and the operations center to facilitate a common counter approach. This is something that I believe in a significant number of municipalities are talking about doing, going down to 1 to 2 outward-facing counters for interaction with the public, so that we can control access and not only keep our staff safe, but keep the public safe. a remote workforce, physical distancing continues to be key to stopping the spread of COVID-19. With the support of technology, more than 700 employees have been effectively redeployed to their homes and have continued to support our operations without incident. This has become our new normal, and we will continue to operate this way where it remains feasible. Financial challenges. Like all municipalities, the financial impact of COVID-19 is significant. Fiscal responsibility is a principle that applies in all circumstances. Now it is even more important. We will continue to look for ways to reduce costs while maintaining service levels to the community. Through innovation, we will embrace the efficiencies gained from changes in our service delivery models on a permanent basis. For example, we will go digital where possible to encourage online transactions and reduce the need for public access to city facilities. This includes launching a new digital permitting portal that enables citizen and building industry professionals to apply for, track, and pay for permits online. It also includes digitization of the Community Recreation Guide and Richmond Hill Center for the Performing Arts seasonal brochures. We will continue to enhance our technological infrastructure to facilitate remote work where feasible. We will use IT resources to facilitate these options in an efficient and effective manner. IT really is the foundation of having a digital society and a digital workforce, and we will invest in those options so that we can continue to keep our staff and residents safe while delivering our services in the most effective and efficient manner and at the service level that our residents and businesses enjoy. We will implement a continuous improvement program to generate further efficiencies to keep our costs down and address the financial needs that we are incurring. Well, while the COVID-19 pandemic posed considerable challenges, there were also opportunities to adopt practices and technology that will help us to not only just return to normal, but build back better. This is a term often used in our recovery practices to reflect how an organization can emerge from a crisis and be more resilient and citizen-centric. And that is our intent. We have a 5-phased approach to reopening. We have established this 5-phase framework. We will exercise extreme caution and recognize that the phases could change depending on the state of the pandemic and related guidance from the province and public health officials. We are well into the mobilization phase and anticipate reaching phase 5 approximately this time next year, if we do not need to reinstate physical distancing measures should there be a resurgence of COVID-19. Launching a new digital, next slide. For the first phase of the resumption plan, our focus is on mobilization. As the principles outlined, we are aligning with provincial guidelines and will follow the Ontario Chief Medical Officer of Health's advice. However, we will only proceed to the next phase if we are prepared to do so as a city in a safe manner. In this mobilization phase, we established the city's resumption plan committee and developed the city resumption framework. As I noted earlier, our aim is to build back better and to create a more resilient, citizen-centered organization. We are conducting a business impact analysis to determine future office and space needs. This links to the principles of supporting a remote workforce, innovation, and the citizen-centric services that we offer. This work will consider the types of services we provide, staff and public health and safety, PPE requirements, the number of staff we need on premises to deliver these services, and the policies and procedures we require to adopt and process the needs to modification. Those who are working remotely will continue to do so unless they are otherwise required, and our city facilities will remain closed to the public. With the changes to the provincial guidelines last week, we began the process of opening our neighborhood park amenities, including sports fields, tennis courts, and off-leash dog parks. The community park amenities at Elgin West and Ridgevale are slated to open the first week of June, and we are targeting June 8th to open the amenities at destination parks such as Mill Pond and Lake Wilcox. It is important that we open slowly and learn from each phase. If there are issues in any of the phases, we may recommend further slowing of future phases. In phase 2, we will continue our gradual reopening. In this phase, work from home arrangements will continue where possible, and staff who are redeployed will continue in their redeployed positions. Through the pandemic, we learned that by appointment arrangements can be effective, and will continue to do so for services such as development applications and building permits. We have received no change in the numbers approved in those areas, and our approach has been effective and safe. So we will continue this method into the future. During this phase, we will also use the information gathered in phase 1 to begin developing and implementing our long-term plans. We will finalize the reopening plans for recreation and culture facilities, including community centers, ice rinks, pools, and the Richmond Hill Center for the Performing Arts. During phase 3, we will continue to apply the principles I outlined earlier to build back better. We anticipate that we will begin to gradually reopen the main municipal offices and the operations buildings to the public on the ground floors. This one-stop service is an example of building back better and reflects the principles I outlined earlier. We will continue to implement our resumption plans, and staff will continue to work remotely and will do so wherever possible. This is part of our new normal. During this phase, we also anticipate that the province may continue to relax the restrictions on public gatherings. We will watch this carefully and make decisions for fall festivals at that time. Into 2021, we are expecting our city facilities to open with less stringent restrictions. This is the time when we will fully operationalize our common counter approach for the ground floor at the main municipal offices and operations center, and with council's approval of our payment acceptance our payment acceptance policy will be fully in place, which may or may not entitle a cashless operation. Also, by early 2021, we anticipate that the province will further relax the restrictions on public gatherings, and we will look to do the same. Through phase 5, while health and safety remains a priority, we will resume services in a way that builds resilience and with a focus on the citizen-centric service delivery model. At the heart of it, innovation is about problem solving. While the COVID-19 pandemic brought about significant operational challenges, it also is presenting an opportunity to identify solutions to how we create a more resilient, citizen-centric organization, reduce building operation costs, realize additional revenue opportunities, and protect the health and safety of our public and our staff. Our plan is to hire a consultant to develop a 2-year strategic plan. This is usually a 4-year plan developed with each term of council, but whether this had happened or not, we would be recommending that at this time, we develop a 2-year plan given our current circumstance. The consultant will work with council to determine what is council's promise to the community. What does success look like? And how will we measure and communicate these results? Staff will develop a full 2-year model and bring it back to council for adoption on how to address those items and fully communicate to the community your vision. We will continue to embrace the art of the possible as we navigate this uncharted territory. Thank you. I turn it back to you, Mr. Mayor.
Thank you very much. That was very, very interesting, and I was glad that we had an opportunity to look at the 5 ways, because as we know, we've been doing a lot of things on resumption and recovery, and and for not only businesses, but parks and recreation, but every time we've done that, it's health and safety, health and safety, health and safety. And that's truly what we are. We're leaders in, I truly believe, at this point in time. Comments. Well, I'm just going to take them as I see them. Councillor Sullivan. Go ahead.
Thank you, Mr. Mayor. And thank you so much, Interim CAO Dempster. Even though it says Stephen Hike, I knew we recognize that it's you, that little window. Thank you very much for your presentation. And I want to also thank all of our staff for the phenomenal work that they are doing as we move through these extraordinary times with extraordinary measures. From the work that is done with the emergency task force, emergency operations, to the daily work done through bylaw officers and parks people, and garbage, everything. It is quite remarkable, and how we have, under your guidance, managed to face this head on and truly do this in such a professional manner. I can't thank you enough. I can't praise you enough. And I just wanted to publicly say I'm so proud of you and everybody. This is a phenomenal job. With regards to the presentation you just gave us, fully support it, and I would move the motion and move to accept your report. I do have just a couple of questions that I would like to ask you through the mayor. When we look at, and I know that you and I have had this discussion before, when we look at phases 4 and 5, as we move to open the building again and start to have a more normalized way of doing things on a daily.
You didn't get this already?
Sorry. Okay.
Did you get the email from me?
There's a few. Councillor Munch, you're on. Please mute. I would like to know a couple of things that concern me. When we look at all the manner in which we're going to fix the ground floor, so to speak, we're going to make access easier for the public. All those initiatives. How are we going to also make the building more secure? Because I think that this would be a good time for us to be doing this while we're looking at making certain changes to the ground floor. I also believe that time-wise, budget-wise, it would be a good time for us to also look at certain security issues in the building with regards to the ground floor, and then of course the first floor, possibly the second floor as well, which houses HR. So that's a discussion I would like to have openly here with you. And to that as well, I would like to also ask, have you and your team looked at the manner in which we are possibly going to have to make alterations to council chambers, possibly spread council members out more on the bench? There is room for us to be spread out further for social physical distancing. And then how are we going to accommodate the public in the public gallery? Have you looked at ways and means for us to do that as well?
Through you, Mr. Mayor. Thank you for the question. I will answer that into two parts. With respect to the citizen-focused approach to having 1 to 2 public-facing counters, one here on the main floor at East Beaver Creek and possibly one at operations, is to give options. With respect to Access Richmond Hill, the majority of staff are, in our opinion, would remain home because they're on the phones and they're on email. The number of people actually physically responding to the counter is significantly less. And we would look how to be able to do that with 2 counters. That's from a health and safety perspective for both the residents and staff, so that we don't have people freely moving around the building. It's also from a security perspective. We did have a security review, and we did have a lot of there's a lot of risk associated with being able to move so freely through our buildings, whether it be through the stairwells or the elevators. So as part of the accommodation project that's being led through the city manager's office, and with what our interim commissioner of environmental infrastructure services referred to in the last presentation, we will be looking at the security of our building as well as the maintaining services for our public. People do not like to have to go, there's some processes where they have to go to 3 floors on the building just to get a permit or to pay for it, or, you know, development charges. That's a lot. It's frustrating for our customers when you ask. So being able to remove ourselves from the siloed departmental operations and take staff who actually serve the public and put them all in one location or 2 locations, split it up between the operations center and city hall, is going to be ideal for our public. But there's the security piece of it too, because we'll be able to lock down our elevators to only our access and our stairwells to only our access with fobs. With respect to the first floor, that would be part of the accommodation study as well as part of our resumption planning, looking at how can we resume in-person council meetings. When would we resume them and how could we resume them? That would be looked at there. We haven't looked at it yet, but we do know that we do not meet the physical distancing in the council chambers in our current format. So it would have to be addressed before we could operate in person again. I hope I answered all of your questions.
Yes, no, you have. Thank you. I know there's so much to think of on such on sort of on the macro, but on the micro, there's you know, I've thought about issues with regards to council chambers and you know, shields and if somebody steps up to the podium to speak, how do you protect that mic to the next person? There's so many issues that we have to look at, and I know that will come eventually. So I just wanted to bring it into the discussion because I know that it's going to become a part of our new normal lexicon. The only other thing I would like to suggest through you, Mr. Mayor, to our interim CAO is that when we do open and permit public access back into our buildings, specifically 225 EBC and OPS, that we have masks available for the public to put on. When they enter the building, we have to always be alert and concerned about asymptomatic infection. And I believe to protect our staff, because people wear masks to respectfully protect everybody else other than themselves, I think it would be necessary for us to be providing masks for people to be wearing as they enter the building. So just a suggestion that I hope will be considered.
Thank you.
Thank you very much.
No, thank you.
Again, thank you.
I have a list of people here. I would like if we can keep our discussions here to 5 minutes. We had some guests there before, and if we can just keep going. And I would ask yourself, city manager interim, will you be bringing us up to date as we move along through this process? Because I know we've all have a question exactly as we just had in the first there. When is that going to happen? When is that going to happen? You'll be bringing us on an up-to-date process?
As through you, Mr. Mayor, as changes occur, we will be communicating with council in real time. We won't wait for a council meeting. We'll be communicating in real time through email, but we also will be communicating in real time with the public.
Yep.
So as we move into each phase, but we will make adjustments. The principles will remain the same. We'll make adjustments based on how the orders come up from the province.
So all of our interest here is we don't need to kind of cover it all right now. That's all. I'm trying to prove that we will have a chance. Councilor Barros.
Thank you, Mr. Mayor. Before I offer to second this motion, I have a question for the mover and perhaps commentary from the city manager. The Bank of Canada has put out a statement early on, and they've updated it since. And their press release was the Bank of Canada asks retailers to continue accepting cash. I don't think that we are going to find ourselves in good graces with some of the members of our community that work in a cashless, in a cash type environment. And it speaks through that in their press release that there are some people in our community that are disadvantaged and they don't have credit cards, and they may not even in some cases be utilizing a bank to its full extent. So to the mover, would you consider that language in there? And maybe the question to the city manager is, was that a hard and fast part of the motion, part of the recommendation, or was that a consideration that you were looking at?
From my perspective, just before our interim CAO speaks, yes, I have no problem adding that. I just would like to know, as you from Marianne, exactly where we stand on that. I do understand that handling of money, of notes and coins pose a concern, transmission concern. So I would like to hear from our interim CAO.
Through you, Mr. Mayor. Our recommendation was long-term, we would be looking to reduce the amount of cash we took in one transaction as part of the payment policy. But in the interim, as part of our phased approach, we would be looking at not accepting cash because of the health and safety associated with it. I do recognize that the bank did make that statement. Although I also recognize a lot of businesses, as they reopen, have not been taking cash for the health and safety. I mean, cash does breed bacteria, and disease can live on it. So from a health and safety perspective during this pandemic, we are recommending that we do not accept cash. We have been in this state, our doors have been closed for over 2 months, and we have not had any issues with payments. No one had, they're still coming in. There's been no change in the activity. We do already receive in some areas over 75% electronically anyways. So we don't foresee an issue with that. But during the pandemic, we would be recommending not accepting cash for the safety of our staff.
So if I may, Councillor Barros. So are you saying, Marianne, are you saying that it's only through the pandemic or into the future?
Mr. Mayor, through you, through the pandemic, through our phased approach to reopening, we would be recommending not accepting cash as part of our payment policy that's coming forward for council adoption. That is recommending a reduced amount per transaction on acceptance, because we currently do not have a maximum that we will accept. And that was noted in the audit that is a risk for multiple reasons that will be explained as part of that report. So that our policy moving forward will be a reduced per transaction amount, but during our phased opening, we're recommending that we do not accept cash.
But you will accept a check?
Yes, we do accept checks. We continue to accept checks through the mail.
Exactly. Okay, thank you. No, with that in mind, Councillor Barros, I would leave the motion as is.
Through you, Mr. Mayor, I will not be seconding the motion, and I will not be voting in favor of it. I feel that this is a non-starter for some members of our community, and I don't think that as a government agency, we should be taking that kind of a hard stand when it comes to something like that. The Bank of Canada, in their press release, describes the safe handling of money. So to suggest that by bringing it in is not able to be dealt with, that's just not the case. So I thank you for that, Mr. Mayor. And unfortunately, there's a lot of really good things in this report that that if it doesn't pass, unfortunately won't happen. So I'd hate for us to be in a situation over such a small item to throw out the rest of it. But I'll allow the rest of my colleagues to speak, although there really is nothing seconded on the floor yet. Thank you, Mr. Mayor.
Councillor West.
Thank you. My I mean, I think Councillor Barros does bring up a point that probably needs to be examined, and I appreciate that. But my interpretation of this is that you're right. I mean, there is a whole bunch of stuff in this direction, and it would seem logical to me. I would be happy to second it, because it would seem logical to me that the specific item that you're dealing with, and I think it does warrant more discussion from us as council members, to staff, but that issue will be decided upon when the report comes to council, and that's what Acting CAO Dempster said. So in the interim time between now and then, I'm happy to examine the issues that Councillor Barros has brought up and then make a decision as to whether that part of the specific policy when it comes to council can be modified. Am I correct in assuming that that is a viable approach so that we don't throw the baby out with the bathwater? To you, Ms. Dempster?
To you, Mr. Mayor, the councillor, that is a viable approach. The policy is intended to come towards the end of June or the beginning of July to council, the payment policy, which has the recommendations about the reduced amount of cash. We were proposing cashless because right straight through to phase 3, we're doing gradual reopening, and we're not recommending that we open our counters up during those phases. I believe it's towards the end of phase 3, phase 4, where we would looking at opening up our counters to the public, and that's not until the latter part of the fall or the winter. We can bring, I hear what you're saying. We can, that's not an item that we absolutely need. It's something that we could bring back in a report. I would be fine with bringing back in a report the pros and cons of a cashless operation before we open up our counters to the public and have council have that open discussion regarding
okay.
that.
I'm totally comfortable with that approach. I appreciate the input, and I think that it sounds to me like both Councillor Barros and Councillor Silvitz, I don't want to speak for you two, but I think that a more fulsome discussion on that specific point is warranted. And I will commit that I want to speak about that at your earliest convenience, Ms. Dempster. I think that's a good point. Anyway, let me move on to the points I was going to be making though. Thank you to staff for putting together a very difficult and complex plan for reopening. And I'm glad that we're doing this, obviously, and hopeful that we're going to be able to do it as quickly as we're hoping, and perhaps even better if we do better from a public health perspective. I think it's very important right now that our public knows that we are in a leadership position, we have a plan to move forward, and as much as possible during the uncertainties that we're facing, that we understand how we're going to get there and even kind of when we're going to get there. I am fully understanding, and I think Mayor Barrow kind of said this as well, that we are, that this plan is very much contingent on safety first. In this particular case, we need to make sure that we do everything in our power as civic leaders to make sure that we're helping to keep our community safe. And I think that's #1 priority. I guess where I'm leading with this is that I'm in agreement with the general directions that you're talking about. But I think it's really important that the public has a very firm and good understanding of what to expect and when. And given the pandemic, I think there is somewhat less opportunities for the word to get out. So what are we going to be doing once, like, assuming that this passes today and this is kind of the general direction forward, given all of the uncertainties that we have, what is staff's plan to communicate this to the public and make sure that everybody knows what we're planning on doing?
Thank you, Mr. Mayor, to the councillor. We have developed a framework document based on this information, a complete framework document that will be distributed to council today. We can take out the cashless operation piece of it and have that discussion later, but as one of the principles. But that framework document is in draft. It will be finalized today after this meeting. We'll send it out to council. Send it to council and staff. We'll be putting it on our website and releasing it to the public.
Okay, that's perfect. That's all I want to hear. And actually, I do appreciate that one modification that you're describing. I think that it warrants more discussion, and that's the point of having a council meeting like this where we can have a collaborative discussion. So I'm fine with that. Thank you. I'm happy to second it. And again, I thank you for the work that you're doing. I know this is likely not what most of the staff signed up with their expectation to be doing in their jobs, but it just goes to show the versatility that our staff has in dealing with whatever comes down the road. And COVID-19 was the thing that came down the road right now. So thank you very much, and we appreciate it. Thank you.
Thank you, Councillor DePaula.
Thank you, Mr. Mayor. Thank you, interim city manager, for the report. I do support and appreciate everything that's in the report. I think it's a good measured approach, and focusing on thriving and really recovering is essential. But I do agree with Councillor Barros, and I will not support a policy, or I can't even support the entire report if it has in there that we're going to long term try to phase out the acceptance of cash. I can't support our, if we have residents coming to pay their taxes at City Hall or their water bill, and we're actually turning them away when they're coming in with cash. Canadian money now, the new money, can be washed. It can be thrown in a big sink, kept for 48, 72 hours. We got to remember that it's not about our convenience. It's about the residents' convenience. And, for a small cost, we can still make sure our staff is safe. That's important also. But maybe if we could see the motion on a screen. It's been moved and seconded. I guess it's the whole report. Mr. Mayor, if there's some way the reference to phasing out the acceptance of cash.
We're going to do something with it now.
I apologize. Through you, Mr. Mayor, this is the clerk. Ms. Dempster is using the location that we have the video for this. I just want to confirm with both the mover and the seconder that the understanding is that you are endorsing the recommendations contained within the report, but directing the interim city manager to provide more information in respect to the cashless transaction framework.
That is correct.
Thank you. Yeah, we will work the motion up then.
Okay, so with that small change, Mr. Mayor, I'm happy to support the recommendations in the report. I'll just have a read here.
Mm-hmm.
Yeah, very good. Certainly as a local government, I wouldn't want to go against Bank of Canada recommendations to retailers. So thank you, Mr. Mayor.
Okay, I'm sorry. Did you wish? Yeah.
Thank you, Mr. Mayor. I just have something to add.
Does not have a view of it, so go ahead.
With the framework document, we will update, based on the motion, if it passes, we will update the document to remove the principle of a cashless operation until we can come back and have a fulsome discussion about it. So when that document is released to you later today and to the public, it will not have that principle within it until we have more of a discussion about it.
Okay,
I just wanted to clarify.
That's more understandable as to what it is. All right, I still have a list of people. Councillor Chan, I had yourself here too.
Well, actually, I didn't raise my hand, but
okay.
But I just want to thank. But now that I'm being called upon, I want to thank the interim city manager and everybody who've been working, whether in the office, remotely. But this is really a challenging time, and thank you all the good work. And generally speaking, I like the approach of doing it gradually. And in fact, there are issues that obviously need to be discussed later on, including what the motion on B part. I think many places, including Richmond Hill, we're still watching and looking at how we are going to adapt to and to the new way of doing things. So cash is only one issue. There are certainly other issues we might have to look at. So generally speaking, with the way that is now modified, with having a staff report coming back on council regarding cashless, I am prepared to support the motion in front of us. And thank you again to the staff for everything you have done. Appreciate that. Thank you, Mr. Mayor.
Okay, thank you. So we do have a mover and a seconder. We do have the motion before us.
Record the vote, please.
Thank you.
That's fine.
Through you, Mr. Mayor, voting on the motion of Councillor Silovitz, seconded by Councillor West. Councillor Silovitz.
Yes.
Councillor West.
Yes.
Regional Local Councillor DePaula.
Yes.
Mayor Barrow.
Yes.
Counselor Munch,
Yes.
Counselor Liu,
Yes.
Counselor Barrow,
With the changes, I can now vote yes.
Regional Local Counselor Pirelli,
I'll go along to get along.
yes or no, please, Regional Local Counselor?
Yes or no, please.
Sorry, Counselor, I do,
Yes, I'd like to take this opportunity to thank, now that I've been called upon,
No, this is
thank everyone. I'd like to list them all alphabetically. I'd like to start with anyone with the last name that starts with an A.
Are you a yes or a no, sir?
And I'd like to thank everybody for all their hard work.
Point
Yes.
of order, Mr.
Yes.
Point of order, Mr. Mayor.
Yes,
Yes has been said, please.
thank you. Counselor Chan,
Yes.
that motion carries unanimously.
All right,
shocking, shocking.
let's go. Thank you very much. We are now moving ourselves along to the delegations. Correct. Our first delegate is Jason Lee, 11491 Leslie Street, regarding amendment of the kennel licensing bylaw. Items 12.5 and 15.1. So can we arrange for Mr. Lee to be here?
Mr. Lee needs to unmute.
There he is.
There you go, Mike. Is that right?
You are right, sir. Go ahead, Jason.
I would just like to address the matter that's been brought to my attention in regards to the amendment potentially going through. But essentially, I'm being told if this amendment or there is an amendment to the bylaw, I'm no longer able to get a license and operate our business. And I'm very concerned with that. I had a brief conversation with Tracy Steele, who contacted me back in regards to what was going on, to try and clarify for me what this amendment means. But essentially, if nothing changes, due to the fact that the zoning department has granted the builder around me permission to build, I'm no longer able to operate my business. And she's told me that the builder has verbally given them some modifications that they're going to do, but nothing has been given in writing that is going to secure my ability to continue working and carry on our business in Richmond Hill.
Okay. Ms. Steele, you wish to comment on that? Based on that discussion, he's asking a question. Does he still have a license?
Okay, so just to clarify, the purpose of this amendment is to ensure that he can get his license renewed in December when it comes up for renewal. Right now, the way the bylaw exists, it has a 100-foot setback requirement in it, and that needs to be either amended or repealed in order to ensure that he can get his license. So approval of this, the recommendation of the report, will ensure that he can get his license.
Sure.
Yeah, so I understand that being said to me, but my concern is the fact that she has indicated to me that, yes, there will be a potential removal of the setback, but who is then to say that the builder is now not going to, once the setback is removed, come and start building closer to the property line because such setback has been removed? And the answer that I was given was regards to that they have, once again, verbally agreed to certain things, but nothing is put in writing. So if nothing is put in writing, if that particular person who is given this verbal agreement quits, resigns, no longer works there, and the next person comes along and says, oh, look, there's no setback, and for us to be able to build, then they can go right ahead and do what they need to do in regards to not having any concern for my business. And also, if there is no revision for a setback being removed, am I now in compliance with a zoning bylaw where I will not be able to get my license because the zoning people also then say, hang on, you don't meet our zoning requirements?
Okay, I had that same question myself when I saw this, and had the understanding And I'm not sure where we are with your neighbor that is the one that's causing your concern.
Yes.
I don't know whether there's something that has to be completed there before you would be feeling more confident of your ability to keep your business there. And I don't know whether the timing of that, if we deferred it to another meeting, would that undermine your anything. Ms. Steele to start with. And I'm sure there's nobody from planning here because I just brought that into the conversation.
Through you, Mr. Chair, I think I can answer the question. So the zoning bylaw and the subdivision application for the adjacent development are actually approved pending the approval of the site plan. And the site plan is currently under review by the planning department. I've been in contact with them. So when our planners now approving the site plan, it's at a point, the reason we came forward with this now is because it's at a point where we're confident that the reasonable setbacks can be kept in place and Mr. Lee will be able to get his license. There's actually a landscape buffer and a road in between any of the residents, so in the existing site plan.
Okay, well, I don't know. What's the sense? Councillor Barrows, I'm thinking we need to move this aside for a while so he does get planning.
Mr. Mayor, I think that Mr. Lee's business needs to be grandfathered and protected. Much the same as in Oak Ridges many years ago, builders built around a mushroom farm. And now I started getting complaints from people that the mushroom farm was smelly. And Mr. Lee's kennel may create some noises, but the fact is people are buying a home around an existing building, an existing use. Buyer beware. If you're gonna buy a house next to a dog kennel, the dogs might bark. We can't blame Mr. Lee for that. So we need to protect him somehow through this process. I don't know if there's suggested wording for it, but that's my comment. Mr. Lee, thank you for coming.
Yes, well, I've been indicated by Tracy Steele that yes, the builder has indicated that he will be notifying any purchasers of my existing business and that he will be doing certain things, but these are all verbal communications. Nothing has been put in writing, and that's all I would ask is if something be actually put in writing by the builder to ensure my safety for people not trying to take legal action against me, or the city then coming after me saying I'm creating too much noise or causing a disturbance, which would then be compromising me with my standing in the city.
And I completely understand, and Mr. Lee, my intention was to provide a legal document from the city to you to grandfather your use. It wouldn't be coming from a builder or an external, but us as the city protecting your existing use. Now, that would have to be a longer discussion between you and our legal department. It may be an existing use. It may not be a transferable use. I don't know all those details. You know, you might be able to do it as long as you own it, but if you sell it, maybe that's when the deal dies. But
yeah, I understand all of that.
For me to be getting into those weeds right now. Thank you, Mr. Mayor.
Well, that was purely my reason for trying to join into this conversation, because when I just go by the wording that's in the documentation, I don't feel I'm business is not really protected by just removal of a stack.
All right. I'll go back to Ms. Steele.
Well, Tracy would like to speak. Yeah.
So I just want to say that is exactly the intent of the report. The fact is that the current licensing bylaw includes a requirement for a setback, and the report recommends removing that setback requirement so that Mr. Lee's business can continue to operate. It's not a zoning bylaw. That's part of the problem here. It's a licensing bylaw. So grandfathering requirements that typically apply to zoning don't necessarily apply to zoning. We have to repeal that section of the bylaw, and that's what the report recommends, so that he can move forward and continue to operate his business. And with respect to the verbal agreements that the developer has made, those are about implementing landscaping through the site plan application for their application and giving notice to the purchasers of the lots in that area.
When will that be done? I think that's what he's saying. He hears it, but he doesn't see it.
Yeah,
Right, that will be done through the site plan agreement.
Okay. Well, can we add a C here in this whole process, that the planning process, make sure that he does, I still don't get it. Yeah, this is like the patio on Yonge Street. You know, there was a store there and then somebody built a condo there and then all of a sudden the patio couldn't be there anymore because it was beside a residential house. This is the same. This gentleman's got a business that's working there fine. Somebody wants to put homes beside it. It's absolutely right. The buyer has to be the one that has to be concerned from anything else. I'm just trying to make sure that if this can't be done at the same time, why are we doing this as far as changing the bylaw right now when we don't have the ability to say or have the ability that those things will actually happen through the planning process? That's why I'd like to refer it to the next council meeting, if that's something that can be done. Is that going to change anything in your process, Ms. Steele?
So just to reiterate, this is to do exactly what you want it to do. We have to repeal that section of the licensing bylaw in order to continue to allow him to operate. That's what we're trying to do here. Basically, we're trying to grandfather his business. It's just that it's not a zoning bylaw under the Planning Act. It's a municipal act bylaw, and so it doesn't become legal non-conforming like with zoning bylaws. It's a licensing bylaw. We actually have to repeal the clause.
And I understand that completely. I just want, like I said, I don't want to be then told by a zoning person, because they've now built around me, I'm no longer able to run my business because of another technicality or clause which I don't obviously know about or have not been indicated to prior to this being changed.
Which will be conferred by who? Okay.
I'm sorry to make this difficult. I'm just trying to protect myself and my business.
Hey, that's why you're here, and I agree with you. All right, is there? Okay, so is there someone who wishes to move it to the June meeting? Councillor Liu?
Yes, thank you, Mr. Mayor. I wouldn't mind a referral because I think Mr. Lee's concern is legitimate, and I think we should, somehow give him a peace of mind. And I don't mind referring it, but through you, Mr. Mayor, to Tracy, Ms. Steeles, is there a timeline for this to pass? Can we refer it to the next council meeting? Because I'm not only concerned about Mr. Lee's, I'm also concerned about the new buyer. How are we going to protect them and, prevent them from, when they move in, they got to complain to our bylaw that there are noise and museums and stuff. And I'm also concerned about that. I understand this is complicated because it's supposed to be a zoning matter now, is because of the grandfathering. It's a licensing matter. So myself.
Okay. Through you, Mr. Chair, I would suggest that we can certainly refer it, and we'll bring something back that goes along with it from planning to clarify how the planning application for the adjacent development applies, because I think that seems to be the issue here.
Thank you. Okay, Councilor Barrows, saw your hand up again. Go ahead.
I was just going to say that I would second the referral of Councillor Liu to bring back. I think there's just a lot of confusion around what the director has actually brought us. I think what she's actually brought us takes us where we need to go, but I think there just needs to be some more explanation before we actually enshrine it. So I'm more than happy to second this so that discussion can take place before we do it.
Okay. We have a mover and a seconder for referral. Is there any other, should be no, do you want More comments? Councilor Crowley. Go ahead, sir.
Thank you, Mr. Mayor. I'm happy to support this motion. And I just want Jason to understand that, Jason, no matter how we move forward, we're going to make sure that your business is protected.
Exactly.
So I will give you that.
I appreciate that, but even in this notification, it has told me if there is no amendments or no changes, I'm not able or eligible to get my license renewed in December of this year. I've already been, and that's in writing in your report.
Okay, we're sending it back, sir.
We're not going to make a decision today. That's what this motion says. We're going to make it in June. Between now and the next meeting, nothing is going to change. And we're going to make sure that we've addressed all your concerns. Thank you for bringing them up here so we can address them in advance instead of trying to do it retroactively. But I just want to give you those assurances that we will make sure that your business stays viable.
Yep.
Thank you very much, and I appreciate that.
You're very welcome.
Okay.
Those are my comments, Mr. Mayor. Happy to support the difference.
Okay, we have the mover and seconder, and we have the motion. All those in favor? Opposed? That's carrying unanimously. Thank you. All right, our next delegate is Carol Davidson with regard to Lake Wilcox Park pay parking. Let me bring Ms. Davidson in. It sounds like we're bringing people to and from the meeting. There you are.
Hi.
Yes.
Thank you. I'm here to speak to the staff. Thank you, Mr. Mayor. I'm here to speak to the staff report about paid parking at Lake Wilcox Park. And I think most residents would agree this is not what we really want, paid parking. But if it in some way brings organization and control over that park, then I think it's a step in the right direction. You know, the park's been taped up, but you wouldn't know it on the weekends. There's people everywhere there. And I know bylaw officers have tried to keep control of it, but cars are everywhere. And even when the park opens, there's not enough parking for the number of people that want to be there. There's cars parked. I don't know if any of you have been down North Lake Road, but just picture cars parked halfway to Yonge Street, trucks, people, bikes. That park is so full that if paid parking sends the message that if the parking is full, the park is full, except for foot traffic and bicycles, I think that's the way to go rather than doing nothing. But the number one thing is residents obviously must not pay. They already paid for the park. So there's no way residents should pay. I think that the parking lots we do have, paid parking might bring some organization. I kid you not, I have literally seen screaming matches of people trying to get into one of the few parking spots that there are. I've seen people park upside down, around, all over the place to try to stay at that park. I know people with memberships to the gym and other things in the attached community center can't park there because that whole parking lot is filled with people. The same problem now is moved south of here with the skateboard park. Cars are parked all over there too. So there's a huge consideration of making this area inaccessible to the residents, but something has to be done about the crazy overcrowding of the park, the lake in particular. People park in emergency routes. People literally park under the do not stop, do not park signs on Bayview. So the part of the report that suggests more signage, I agree with. Although people on weekends who live in the neighborhood should be able to invite friends over when the COVID-19 stay-at-home orders are lifted and have people park in front of their own homes, which of course they can't do now because there's honestly cars everywhere. We also need, I think this illustrates, we need more parks in Richmond Hill. As we go higher and bigger in large density areas like Bernard KDA, this park can barely take it now. We have to start planning for more green spaces and parks. And if there's one thing we've learned through COVID is that if you're stuck at home for 3 months and you can't get out and walk around, it's not good for people. But that doesn't mean that this park can take the overload from Bernard KDA. We have to figure out a way to control this park better. I was kind of shocked at the cost of paid parking. And I've made this argument before to council. maybe an alternative is a park manager in the interim, someone with a few staff to say, look, at this parking lot is full, you have to move on, or someone to sort of say, we can't handle any more people at this park. Please pick up your garbage. Please don't put your jet ski in Lake Wilcox, which has a 7-mile-per-hour motor limit for boats, and yet people will bring their jet skis. Whatever you decide, please throw some money at getting this park under control and restricting what I feel are very dangerous crowds. So thank you.
For your comments. We'll go Councilor Barros. One.
Thank you, Mr. Mayor. This is a park like no other park in the city of Richmond Hill. The attraction to water is something that is innate in most people's psyche. To be on that shoreline is just fabulous. And we've built something that is being, hugely successful, to the point of we've developed some problems with it, and that we're working on. I want to thank the operational staff. They've been throwing people at keeping it clean, keeping up with some of the demands. I know we've got staff there that are just dedicated to that particular park. I know that we have bylaw that is there continually when we're in non-COVID times, and even during COVID times, there's been an extra special push on that particular area because of the amount of people that come there. It's not a surprise to us that are in the area. We recognize that there's a lot of people from outside of Richmond Hill that come to this particular attraction because of its waterfront. So I'm happy to support the recommendations that have been put forward by staff. I give the residents my full commitment that this is a first step, and there is going to be needing tweaks as we go along. We've never done this before in Richmond Hill, so it's a first for us. I think it's a good step. I've had some residents question, is this going to actually create a lot more parking capacity? I hope so. I mean, I hope some people say, okay, fine, I'll carpool with another family that's going to the park and create some parking spots. If in the end, if we don't actually see that parking capacity, if people from outside of Richmond Hill are coming to the park, at least we're getting their money so that we can then maintain the facility in the form that we want it maintained. We do need to be working hard at the bylaw department, and if I was in council chambers, I'd be looking directly over at Ms. Steele, saying we need to be working hard on the bylaw to be sure that we protect those residents that live in the surrounding areas from abuse. And I know that we've had many conversations on providing special passes for residents so that they can park in front of their own homes, where we may be putting up no parking signs outside of a permit. So there's a number of things that still need to be fleshed out for all the residents that are watching at home, that may be watching this later. Please be patient with us as we work through this. I want to make sure we get it right. And if we don't get it right exactly the first time, our commitment is to keep working on it to get it to a point where everyone is finding the benefits from it. So the motion is, well, I don't think it's on the screen yet. I'm just seeing it in front of me, my second screen. But Mr. Mayor, I'm happy to move the recommendations and move forward. Thank you.
Okay, Councilor DePaula. No, you're done.
Thank you, Mr. Mayor. I'm happy to second those recommendations. I'm just gonna flip my computer around and share. I have out my back here. Just look right on to the community center there. I'm able to constantly see.
Hit by a car.
I'm able to constantly see the amount of traffic of people that are trying to use this lake. And our bylaw staff are doing a great job barricading the park and preventing residents from using it. And just during this crisis, this is, as Councillor Barrow said, such a successful project by the city. They've done such a great job, and it's now not just our Richmond Hill residents that are enjoying it, but the entire GTA is aware of what a unique feature Lake Wilcox is. And I see the traffic here every day. Those parking lots full, people up and down, include Bayview and parking in our subdivision now that parking is not allowed on Bayview anymore. So it's something that we really have to monitor and get creative and do something different than we've done in the past. Stouffville already does it with Musselman Lake. They charge non-residents to park there. Georgina has $20 per car. If you don't live in Georgina, if you want to park at Willow Beach, that's what they charge non-residents, and non-residents are going up there paying $20, no problem. So I think this is a very good step. It's different for us to charge non-residents. I'm really hesitant to have any parking fees at all, and that's what's great about Richmond Hill. You don't have to pay to park anywhere essentially, but when it comes to Lake Wilcox and maybe down the road the hospital, then I can support this. I want to thank staff for the work they've done with this, and it's going to be trial and error. It's not going to be easy, because every summer, I've been here for 5 years staring at that parking lot, and every year there's 2 and 3 times as many people trying to use this park, and I expect it'll only be greater and greater as we go forward. So happy to support the staff report, and good work to our staff.
Okay, thank you. Councillor Pirelli.
Thank you, Mr. Mayor, and thank you to staff for a wonderful report. This is the result of the great success that this area brings to Richmond Hill. Thanks go out to Councillor Barrows for his dedication for all these years as the Ward 1 councillor. I can confidently say that no individual councillor has brought more to their ward than Councillor Barrows has to Ward 1. Thank you, Councillor Barrows, for your dedication. Number 2, Mr. Mayor, through you, to Deputy Mayor DePaula, I'd like on the record that if I need to go to the park, I can park in your driveway at maybe a reduced rate. Thank you. I got a nod. I'm good with that.
It's already free if you live in Richmond Hill.
Yes, for friends or something, maybe from out of town. But thank you, Deputy Mayor. And so I'm happy to support this, Mr. Mayor, and I hope it's unanimous. Thank you.
Okay. Say any other comments? Our comments are coming from council members at this time. So, Ms. Davidson, so your delegation process is kind of finished. Okay. Any other comments? If none, we have a mover and a seconder. We do?
Good.
Okay, so there it is on screen here. Sorry, my apology. All right, all those in favor?
I
All opposed? How many are in favor, please?
I can't get my screen.
Carries. Thank you.
Recorded vote, Mr. Mayor.
I couldn't hear. I couldn't see.
Thank you. Mr. Mayor, voting on the motion, Regional Local Councillor Pirelli.
Yes.
Councillor Munch. Councillor Munch, please.
Yes, I can.
Yes, thank you.
Couldn't.
Councillor Chan.
Yes.
Councillor West.
Yes.
Mayor Barrow.
Yes.
Councillor Silovitz.
Yes.
Regional Local Councillor DePaula.
Yes.
Councillor Liu.
Yes.
Councillor Barrows.
Yes.
That motion carries unanimously.
All right, thank you. Mr. Clerk, we're moving to the bylaws at this time.
That is correct, Mr. Mayor, and I would bring to your attention that as a result of council's motion to refer the staff report related to the kennel, at this time, the first bylaw, bylaw 2620, should not be passed, but all other bylaws can be passed.
Okay, can I get a mover and a seconder for the bylaws? Councillor Chan, seconder, Councillor Civic, thank you. I don't think there's any questions. We did remove the one that was needed to be removed. All those in favor of bylaws? Opposed? Councillor unanimous. Bylaw to confirm the proceedings of the meeting at council at this meeting. We have same mover and seconder, or okay, Councillor West and Councillor Silovitz. All those in favor? Opposed? Carried. Motion to adjourn. Same mover seconder. All those in favor? And thank you. All right, we are going to take that's the end of our council meeting. We do have a special meeting.